Well, happy Tuesday, everybody. Welcome to the MHN Summit, our second summit of the year. We are admitting folks out of the waiting room, so I'm just going to give folks maybe about 1 minute before we get started.
Good morning, everyone.
Good morning.
Morning.
Good morning.
Good morning. I'm so pleased that all of you guys decided to join us. I know a 6-hour Zoom meeting may have been a bit intimidating. I can promise you that we are going to keep you guys busy, engaged, and we're going to give you lots of good information today over the course of our time together. So I really do appreciate you guys registering and participating in this important work with us.
Surely.
So I see people are still joining us. Oh, Elizabeth, welcome. Well, welcome everybody. I think we're going to go ahead and get started, and I'm super pleased to introduce our welcoming guest, who is Karen Scott with First 5 San Bernardino. I think Karen just logged in, and there she is. Good morning, Miss Karen.
Good morning. Good morning.
We're doing this a little different these days, huh?
Yeah.
Well, we have quite a few people who have joined us on our Zoom, and they're all waiting for you, Miss Karen.
All righty. Well, good morning and welcome. We're so excited you're joining us for another spectacular summit event. As many of you know, this initiative is the result of the ongoing commitment from our dedicated membership, a membership that has grown larger than we could have ever anticipated. We now sit at over 300 individual members that represent over 110 organizations in San Bernardino County. I think that deserves a hand. That is amazing. Over the past year, we have collectively accomplished so much. Some of the things we accomplished that I'm most excited about include our updated consumer survey to obtain more current information about what families are experiencing in our community, our partnership with the criminal justice system to serve one of the most at-risk populations in our county, and our creation of community education information to help providers educate families on a variety of topics. Today, we will spend time reviewing all that has taken place over the last year, as well as look forward to the exciting activities we have before us over the next 12 months, including additional community education campaign efforts that will include text messaging, billboards, and other engaging outreach, the establishment of a unified proactive screening system to identify risks early and get families connected to care, and much more. Thank you for your continued partnership and commitment to making San Bernardino County a safe and healthy place for families. I will now pass it back to Lisa, who will provide an overview of today's event. Welcome.
Lisa, you're muted.
Thank you, Kelly. I appreciate that. Well, I was just saying thank you so much, Karen, for that lovely welcome. We do appreciate your continued support. Okay, so we have a rather full agenda, and Katie, if you wouldn't mind throwing the agenda in the chat just so folks have really easy access to it, that would be really great. We have 3 things that we want to accomplish by the time that we are through today. And that is, we want to provide you guys with an update, right, on all of the great things that have been going on with the Maternal Health Network. So the morning section of our agenda really is reflective. It's going to be about, one, reminding you guys kind of what are the priorities for the Maternal Health Network and for all of our organizations who are members, and what have we done to address our short-term strategies as indicated in our strategic plan. So the morning part of our day is really going to be meant to provide you guys with an update on what have we accomplished together thus far. We also, at the middle of our day, are going to spotlight a collaborative effort around our criminal justice protocol. And so I know Karen referenced that. It's one of our priority populations, a very vulnerable population. We've been working with a number of community partners to move this work forward. We have a couple of them who are going to share with us today. And then the last part of our day is really going to be spent on projecting what do we have coming up in the next year. So you guys might remember, and I'm going to remind you shortly, that our strategic plan is broken up into short-term, long-term, and mid-term priorities. So this upcoming year actually wraps up our short-term priorities from a timing perspective. So we have a lot of inertia that we have going in our favor, and we hope to make significant gains over the next 12 months. So the last part of our day is going to be sharing what are we doing in the next 12 months, and more importantly, what do we need to do with you? Okay, so we have breakouts scheduled in the last part of our day, where, as we always do, we're receiving input from you to provide us with direction on how we can best support you. Tell us how we can help you, right? Help us help you is the last part of our day. So that's what our agenda looks like. A couple of things that you may want to reference throughout the day is, one, our Zoom technical assistance guide. I'm going to hand this over to Katie in just a moment. She's going to provide a high-level overview, but that TA guide really will walk you through if you encounter any problems throughout the day with the technology that we're using to support this summit. The second thing that's going to be really important is the Maternal Health Network strategic plan. We provided you guys with the executive summary so that you could have that 4- or 5-page document just at your reference. So as we're talking through all of the strategies, you go, oh yeah, I remember that. That's how this fits into the larger plan. And then the last thing that you might want to reference is our brand new MHN consumer survey report for 2021. Kim is going to be sharing some slides with you guys, but she's only providing a portion of the valuable information. You may want to refer back to that written document either throughout the presentation or of course in your work moving forward. Okay, so I don't know if you guys have figured this out yet, but when we do these things virtually, it actually takes a whole village, right? So we have a number of SEI team members who are supporting our summit today. So my name is Lisa, and I'm kind of your master of ceremonies. You will see me throughout the day. But one of the things that we learned early on is that you guys don't want to hear Lisa speak all day long, right? So a number of our team members are going to be sharing with you and supporting information. One of those folks is Marika. Marika, would you like to say hello? Marika is our Master Engagement Specialist. So all of the activities that you guys are experiencing today have come out of her great mind. She also will be helping support some of our breakout sessions throughout the day. Katie is here. You all know Katie. She's our Master Communications Specialist. So Katie has really been the caboose who has shoved this train uphill for the last 3 years with the Maternal Health Network. And so she is all things support. Miss Katie, thank you for being here today. Sierra is with us, and Sierra is one of our 2 wizards behind the curtain. So Sierra is here, and she's helping to manage all of the breakout rooms and provide any TA assistance that you might need throughout the day. We have Miss Kelly Marshall, our esteemed leader here, and she has deep roots in San Bernardino, and she has a particular specialty, and that is around, well, she has a number of specialties, but the one she's bringing and highlighting today is really her work within the Maternal Health Network around screening, proactive screening and education. She will be facilitating different breakouts today, and she's also going to be facilitating our panel discussion with our core CJ team later this afternoon. We have Kim Hopkinson, our data diva, and she has been supporting the Maternal Health Network through the snapshot, through the first consumer survey, and most recently through our updated consumer survey report. So she's going to share with you all kinds of really interesting data that we've collected over this past year. Miss Emma has joined our team, and she makes cameos within the Maternal Health Network. She too brings her policy framework and her work around well, I know it as Omni-ASTO, but pregnancy-related work that she actually does in Nevada. So we've been able to leverage that on behalf of the San Bernardino Network. And last but certainly not least, we have Miss Megan. Megan is our second wizard behind the screen. She's managing our PowerPoint, and she will also be supporting you guys throughout the breakout sessions. So with that, thank you to my entire SEI team. I will be seeing you throughout the day. And with that, I think I'm now going to hand it over to Miss Katie to talk a little bit about our technology.
Yeah, happy to. Welcome everyone. I just put a message in the chat for you all, but we just have a couple of things we want to highlight for you to make sure that we can all participate to the fullest extent possible in a virtual setting. So in the chat, you'll find Miss Sierra's number, who you just got to meet, and she is going to be your go-to if you have any technical difficulties throughout the day. Her number is also available on that Zoom technical guide that is also available in the chat. And so if you go ahead and download that, there's all sorts of tips and tricks that we want you to know about how to set up your Zoom to participate with us today, but also just some links to our evaluations, and then Sierra's email and phone number. I will also put a plug in that you can just throw a chat. We have several of us, as you know, monitoring the chat. So if you can't find Sierra's name and you're having an issue, just throw a message in the chat to any of us co-hosts that you'll see in the Zoom to button, and we'll be able to help you. The last thing I want to mention before we get started is we will be using breakout rooms. And because we'll be sending you to a breakout room, it is really important that if you joined via phone, your phone audio is merged to your video. Otherwise, your video will be in one room and your voice will be in another. So if you did join by phone and you don't feel like maybe those two things are merged yet, send us a chat and we can go ahead and help you get that handled before we go into our breakout rooms. All right. Well, like I said, just throw us a chat throughout the day if you're having any technical difficulties. Otherwise, Lisa, I'm handing it back over to you.
And it's a little game of hot potato because I'm actually going to hand it over to Miss Marika to launch our first engagement activity.
That's right. Okay, so I'm hoping you're not all sighing right now like, oh, an icebreaker, because what we're really looking for with this activity is just an opportunity to connect with folks in the network. So this activity is really designed today, so I'm going to get into it, but I just want to kind of like set the stage for you all. So we try not to build that engagement activities that are just sort of one-off, right? There's a purpose behind this. And the one today is it has sort of three purposes. One is to help us sort of establish a positive mindset, look forward into the future, get ourselves future oriented. And then it's also to allow for you to have as much or as little creativity as you would like, right? So we'll get into what that means here. And then the third piece is we really want you to provide an opportunity to let other people get to know you, however you feel comfortable. So whether that's at a personal level, at an organizational level, or sort of in that county level, or as a member of the Maternal Health Network. So we're going to ask you to take 2 minutes. Starting here, when I finish explaining, you're going to take 2 minutes and you're going to write a future newspaper or blog headline. You know, if you're not into newspapers, I don't know, some folks don't get those anymore. That's for a personal, professional, or organizational accomplishment. So we provided a few examples here. So this is the personal one that I wrote for my future self. All right. I'm 4'11". All right. So it's local woman, age 40 and 4'11" becomes Boston Marathon champion. Maybe from that, you can tell that, like, you know, I want to run, I want to be athletic, right? And so if I were to get into my breakout group, I would share that and then maybe share a little bit about myself. An organizational level achievement. So this one is really great. We're forecasting into the future. El Sol receives a $10 million grant to expand services, right? And if I get into my group, I might talk about why that might be so wonderful for my organization and so important, what kind of services I might be providing with that grant. Or maybe I'm forecasting for the county, right? I'm really part of this amazing network and I see so many amazing things happening. And San Bernardino County achieves 0% low birth weight babies. All right, so here's an opportunity for me to think into the future about what we could all accomplish as a group. And I might share with the group why that would be important. So we're going to give you 2 minutes. You're going to write your future newspaper, blog, or headline. Just scribble it down on a piece of paper. Or if you're high tech, you can type it on your computer. Just be thoughtful. And again, as creative or as not creative as you want to be. You could use this exact template here, right? And just insert your own organization, whatever works for you. And then in exactly 2 minutes here, we're going to go into a breakout group and we're going to have an opportunity to share. Maybe you have a great headline. Take a second look at it. Give it a little revise. We're going to take about 30 more seconds. Okay, Megan, can we go on to the second slide here? So we're going to go into our breakout rooms. Sierra's going to open those up for us. We'll be in groups of 3 or 4. And we just want you to share your headlines and consider discussing with folks in the room. Why did you choose this headline? What does it say about you, your organization, or your vision for San Bernardino County? And then what headline did you most enjoy in the group? Because sneak peek, we're going to ask you to come back and share sort of what you voted as your favorite headline, because we're excited to get to know you all a little bit more. So why did you choose this headline and what did you most enjoy in your group? And Sierra, if you can open up those breakout rooms, we're going to send folks into them. And we have 3, I see, sorry, how many minutes? We have 5 minutes.
Oh,
Okay, well, I think we are all back. So in the chat, we would love it if you would share just your favorite headline from your group. In our group, I had Dr. Flores Carter, and we voted her best headline. And I'll just share that with you, that it was, Dr. Flores Carter publishes 5th book in Open Center to serve the community. That's what we see in her future. If you want to share your favorite headline from your group, you can drop that in the chat right now. And I think with that, that'll kind of wrap up our future casting, our positive mindset. Hopefully you had an opportunity to get to know some folks. I'm not seeing any headlines coming in the chat yet, but hopefully that's because you're typing away. We would love to know what your favorite headline is from your group. And I think then we'll send it back to Miss Lisa for our next agenda item.
Thank you, Miss Marika. Okay, so this is probably going to be old news to many of you. It may be a reminder, but I just wanted to sort of set the stage and give you guys a high-level overview of the Maternal Health Network strategic plan. So, you know, we have members always joining us. As Karen had stated in her opening, like when we first started this, like the first year we got 100. We had 100 members. And now we're up to 300 members. So people are always joining our network. And I want to make sure that as we go throughout the day, everyone starts at the same place, that they have a general understanding of what our strategic plan goals are, because that really is the root of everything that we're doing. So I'm going to give you guys a really high level overview of our strategic plan. Okay, so the Maternal Health Network. What is it? Simply stated, we're a group of individuals who are collectively working to improve outcomes for women who are planning to get pregnant, those that are pregnant, and those who have recently delivered. And I should actually probably use different language. Families. We're supporting families, not just the one who's actually birthing the child. And one of the first things we did after we gathered people together in this maternal health network is that we set forth a vision. You know, our work is being guided by sort of a collective impact framework that says, you know, you cannot solve difficult problems without complex solutions. And so we thought it really important to develop a vision that everyone could get behind and use as a guidepost for all of our decisions and our actions. So you can see here the vision that we came up with, drafted at the leadership team level, but then actually adopted by the whole membership in a summit very similar to this in person, is that the Maternal Health Network of San Bernardino County empowers, respects, and supports families before, during, and after pregnancy. And this is the important part, to optimize health and well-being for babies as well as mothers. We have also established these 5 sort of guiding principles, which include equity, integrity, access, high quality, and support. We actually provide a definition for that in the strategic plan. So if you want to know what exactly that means, what is our definition of that as it pertains to the Maternal Health Network, I'll refer you to the strategic plan document. But just wanted to remind you guys, that is our sort of framework for all the decisions that we make on behalf of the network. Okay, so what I tell folks often is that, you know, we have a 5-year plan, and our 5-year plan has 5 goals. The first and most important one really is around equity. So our goal is that we want to ensure that there will be equity in experiences as well as outcomes for African American and Black families engaged in the maternal health system. And this is because through our needs assessment process, we found that even in areas where San Bernardino was faring either as well as or better than state and national averages, that wasn't the case for Black and families. Because of this issue, it is our sort of primary area where we focus the bulk of our resources and our priorities. Okay, let's go to the next one. Okay, so the second area is early identification of risk. And so through our needs assessment process, we said, you know, there are things that create complications, and we want to identify those risks early and provide support and education as early as possible to mitigate those risks. The risks that we identified include things like stress, obesity, diabetes, alcohol, and other drugs, as well as mental health issues for families who are preparing for a new child. So one of our goals is to make sure that we're identifying risks early and we're providing supports and education to mitigate those risks. Okay, the third one really has to do with access to community resources. So if you look at our website, which you're going to get a preview of that here shortly, you'll see that we have collected a compendium of resources that are available to families throughout the maternal health network. But what we found is that despite all of the resources that are available, there still isn't enough to meet community needs. And so what we said is we're going to prioritize some services that the whole network should look to expand. Those include things like Black infant health, pre and interconception care, breastfeeding, behavioral health, midwives and doulas, as well as home visiting. Now, having said that, we know that we can't fill all of those gaps. So what we're looking to do is how can we actually get people connected to those, to services in general, while we're prioritizing expansion in these particular areas. So we'll share with you how we approach that as we get into our short-term strategies later on. Okay, our fourth issue really has to do with data. And this is not new news, right? So what we found is that oftentimes the data that we have available is sometimes outdated. It doesn't include all of the populations that we're trying to serve, and that folks tend to not use it because of those issues. And so we're really supporting both the collection of data and the use of data to support programmatic as well as quality improvement efforts throughout the network. Okay, and then our last area is really around provider capacity. So we found through our strategic planning process that there's not enough providers to meet community need, but there's also not enough resources and supports so that those providers can provide the best service available. And so we really wanted to focus our efforts on increasing provider capacity through a number of strategies. One of the things that we just learned yesterday is that we partnered with Loma Linda on a federal grant that actually supports interns within the maternal health system of PhD, like doctoral individuals, and they received that funding. And so we're looking forward to partnering with them to really support this particular area of our strategic plan in the next, I think it's a 3-year grant. So we're really excited about that. That's like new news, hot off the press. You guys are the first to find out about that. So we're really excited about that. Okay, so this is how all of those goals actually get turned into action. So we've created this collaborative plan of action. It includes 14 strategies as a means to address those 5 priority areas. So what you'll see when you look at this particular document is not only kind of where that strategy exists in terms of the efforts that we're making. So we have like 5 effort areas: policy and practice, community ed, service expansion, data collection, and workforce development. But you also see by those icons where that strategy actually impacts multiple goal areas. So again, this is a really nice frame of reference as we go throughout the day. So that is my sort of high-level summary of our strategic plan. I am now going to hand over the slides to Kim, who's going to provide us information on our new website. Ms. Kim?
It's Lisa. So I realized that one of the ways you could have introduced me today is that I'm like the high level person, because what I'm going to say every time before I start speaking is, so I'm not going to go into all the details. I'm going to give you a very high level overview of this. So today I'm going to give you a very high level overview of the MHN website. And the reason for that is because after about 10 minutes of us walking through the website together, you guys are going to actually have the opportunity to pair off and explore the website as part of another activity. I will say that that activity has a raffle prize associated with it. So I hope that that will encourage you to, you know, I'm not going to say take notes during this presentation, but it won't hurt because I am going to drop some hints along the way that will help guide you to completing the activity, which, just as a spoiler, is a bingo card. So we're going to ask you to explore the website and fill out a bingo card. So in a few places here, I'm going to provide some teasers of where you might find information. So the MHN website, which I hope many of you are familiar with, was launched in January of 2021. And really that was to serve as a repository for communication materials and itself to serve as a communication platform for providers and possibly families within San Bernardino County. If you guys do opt to follow along with the presentation, if you want to pull up the website, I think Katie can put that link in the chat if you're not familiar with it offhand. If you're doing that, please make sure to open it in Chrome if at all possible. That's going to give you the best viewing experience. All right. So again, we're going to go through this relatively quickly. On the landing page, which is what you can see here, it provides an overview of the MHN. It's going to give you some information about MHN's priorities, as well as some background on why the MHN has chosen to focus its efforts as it has. So sort of what Lisa was just covering, those 5 priorities, those 5 goals within 5 years of the strategic plan. I do encourage you to read through the landing page at your leisure because it has a lot of information. And one thing to note is, and Megan, you're going to have to advance the slide one more time. That section that just popped up, if at any point you're exploring the website and you want to get back to the landing page, all you have to do is click on the logo on the left and it'll take you right back to the home page. So just something to consider as you're navigating. So now we're going to go through and look at the different sections of the website. So those different headers. Before we jump into that, I do just want to remind you that at the bottom of the website of every single page, you have a website footer. That is another way that you can navigate the website. It also provides contact information. It provides you with the opportunity to do a fillable web form to contact us. And it also provides social media links. Hint, hint, you may want to know where social media links are located on the page as you do the bingo card. That's the most obvious hint that I'm going to give you throughout this quick presentation, but hopefully that'll get you started on your bingo card in a few minutes. All right. So up next, again, if you're navigating the top of the page, the top of the website, which gives you all the page and sub-page headers, you can see that the first one we look at is about the MHN. Now that page provides background about the Maternal Health Network. It outlines how the network was established via the Our Story subpage, which you can see is the first in the dropdown. And then it also provides a link to the unifying vision and values that drive all of the membership efforts. And you can visit that via the Our Vision and Guiding Principles subpage. Right. So moving right along, up next would be the Our Priorities page. Now that main page provides background about how the network was established utilizing a collective impact framework. And you can learn more about that on the Our Framework subpage, which again is the first drop down there, as you can see. It describes what collective impact is and what the 5 pillars of collective impact are. And I would say that's a great place to visit to learn more about the collective impact approach that the MHN has adopted, especially if it's not an approach that you're familiar with in other work. The Our Priorities page, oh, sorry, Megan, if you could go back up just really quickly. There you go. Thanks. The Our Priorities subpage provides information on those 5 priorities that Lisa had just outlined when she was talking about the strategic plan. So you can learn more about them there. And then the Collaborative Plan subpage is actually where you can find the 5-year strategic plan. So you've got the executive summary in the chat, but if you want the full document, you can find that on the Our Collective Plan subpage. Okay, now we can move on. Thanks, Megan. So next up is the Our Members page, and that is pretty self-explanatory. The leadership team subpage provides you with a list of all members of the MHN leadership team. And then the membership subpage actually provides the entire network roster. Now that's something that's changing all the time as new folks opt to join the network and be included on that membership list. And at the end of this presentation, we're actually going to talk about how you can be added to the MHN membership list if that's something that you're interested in. Okay, up next is community resources. Now we're going to spend just a couple minutes here because this is a pretty neat feature of the website. So the first subpage that you'll see here on the dropdown is support for the PEI. Now, if you click on that subpage, that's going to take you to another page that provides information on the work being done by the Perinatal Equity Initiative and the Black Infant Health Program, both of which are aligned with reducing health disparities in San Bernardino. On that page, you can also learn more about the MHN's efforts to support that really important work, which we're actually going to talk about later in the presentation today. But that's a great place to visit if you're interested in what the PEI is doing and how the MHN is working to support them. So the other subpages take you to or provide you with the opportunity to search for community resources by type. This could be really valuable if you're trying to link your families or clients with resources to support their needs. So we're going to walk through what that looks like quickly. So if we go to the next slide, what you'll see is that if from that dropdown, I was to select perinatal mental health resources, that would actually take me to a new page. I know the header is a little bit covered up by the dropdown that says perinatal mental health. That will provide you with groups or topic areas that you can look for providers in. If you were to click on one of those, for example, mental health support group, of which there are 4, you would get taken to a new page that would list those 4 support groups. Then, if you were to click on the Learn More button for one of them, you would actually be brought to a page where you would see their organization, their location, and have the opportunity to help map your families to them. So if you wanted to connect your families to them directly, you can map them and they can type in their address or the location they're coming from, and you can get the best way for them to visit that resource. So that's a pretty useful resource that we hope people will utilize. All right, up next, we have the events and resources dropdown. Here, you can see that these are really going to provide information on community events, provider trainings, and provider resources. So community events is a calendar where we post events that support families involved in the maternal health system. That might be things like the Fathers Are Irreplaceable Virtual Fatherhood Summit that was taking place throughout June of this year, or things like community baby showers. So that's where you can learn about those. We also have the providers training page that's meant to be a central repository for collaborative meetings, as well as organizational specific trainings that might be open to partner participation. So for both the community events and the provider trainings, if you're on that page, you have the opportunity to submit an event that your organization is hosting. And that's really how we generate the content for those pages. So I would encourage you to use those and to submit any events that you want publicized throughout the network. And then finally, we have the provider resource postings on this page. This is where you can find information like the MHN toolkit, communications toolkit that was recently launched just about a month ago, and then the MHN community education bundles that we're going to talk about more today. You can also find recordings from past MHN events there. All right, and then data page. The second to last header is where you'll find data relevant to maternal and infant health outcomes in the county. That's the outcomes subpage. Consumer survey results, that's on the experience subpage. So that would be the consumer survey report from 2019 and the one from 2021 that we're going to present today. And then also an assets and gaps page that provides an analysis of systems level issues that we conducted as a component of the strategic planning process. One thing to point out as we move on to the next slide, which is research and evidence-based practices, is that the data page tends to include data that was produced by the MHN or on behalf of the MHN, whereas the research and evidence-based practices is going to include research from external organizations that we're posting because we think it has relevance to the work the MHN is doing. Things like that may be the Listening to Mothers study that was done in 2016, or I'm sorry, done on mothers who gave birth to children in 2016, and then the maternal and infant health assessment that's conducted statewide. We also have evidence-based practices that align to strategic priorities in that subpage. So that's work being done by other organizations that might inform the work that members of the MHN may want to do. And then last but not least, we have that Get Involved button. So before we move on and ask you to explore the website on your own, I would ask you to open a browser now, because you're going to need to open it in one slide anyway. So if you want to open a browser now, go ahead and grab the link out of the chat if you haven't already that Katie provided, and go ahead and click on the Get Involved button. So that bottom on the far right, sorry, that button on the far right at the top, that's in maroon, and go ahead and take just 30 seconds and go ahead and click on that. and enter your name, email, phone number. And if you could note that you attended the summit today, that would be really helpful so that we can kind of gauge your engagement really with our presentations today. I will say for those of you that are not already receiving the weekly newsletters and email blasts that the MHN sends out, I would also encourage you to just write the word listserv in the type your message box. If you do that, then Katie will add you to our listserv distribution list, and you'll get those newsletters, other email blasts, other requests for participation. And it's a really great resource. All right. So as people are doing that, I think we can move on to the next slide and prep you guys for your activity. So you're going to have probably about 15 minutes. We may end up giving you about 12 just to stay on track. We're going to provide you with a fillable PDF, which Katie has just put in the chat. So you guys are all able to download that. As soon as we exit off of this slide, you are going to be sent into a breakout room with a partner, and we're going to ask you to complete the bingo card together. Once you're done, you're going to email your completed card to this email address, which is also on the bingo card. So you don't have to try and write it down right now. You can just copy and paste it out of the bingo card. Make sure to include your name and your partner's full name on the PDF and then save it before you email it. Because teams who email a completed bingo document are going to be entered into a raffle to receive a $25 gift card each. We are not going to require a blackout bingo for it to be completed. So just one line would count as completed, but I would encourage you to take the full 12 to 15 minutes and check as many boxes as you can, rather than just stopping after you've gotten one line. Okay, so I'm going to pause there. I know that was a very quick review. And I think unless there's anything else, we're going to send people off to their breakouts. Okay. If for some reason you get put in a breakout and there's nobody else there, or the person that's there is not responsive, we apologize, but go ahead and do the bingo card on your own to the best of your ability. Still submit it, and we'd love to see that.
It looks like we got a message in the chat that the bingo card is in half. Hopefully, I'm hoping that one individual has a partner who can see the full document. If anyone else has that issue, please message us directly and we'll go ahead and send it to you via email, okay?
Lisa, you're muted.
Oh, I was just saying, Katie, like I downloaded it to test it through.
Okay, well, welcome back, everyone. I hope that you all had a good time exploring the website with your partner. I will say that we have actually already received some bingo cards in our email, which is exciting. But we did hear from a few folks that they were experiencing some technical difficulties. So what we're going to do is we're going to leave this activity open until the end of lunch. So what we're going to ask is that you please email your completed bingo card by 1 p.m. We're going to compile those, pick a winner during the afternoon, and then we'll announce that winning pair before the end of the summit today. So you have until 1 o'clock to submit your bingo card. If you would like to continue working on your bingo card over lunch with your partner, go ahead and put in the chat your name. Well, I mean, we'll see your name because that's who it's coming from, and the name of your partner. And then when we break for lunch at noon, stay on the call and we'll put you into a breakout room so that you can continue to work on that bingo card if that's something that you'd like to do.
Okay, I just have one question. I clicked the bingo card and I don't see it anywhere in my computer.
Okay, I'll say as well, if you are having trouble getting the bingo card, if you want to send your email address directly to me, you can see me in the chat, Kim Hopkinson, I can email you a bingo card. I'm happy to do that. So anyone, just if you don't want to share your email publicly, you can put it live in the chat for everyone to see. If you'd prefer to send it to me directly, you can do that as well, and we'll get that bingo card emailed. So I see Kanisha is putting in her email address. So go ahead and follow Kanisha's lead, and we'll get the bingo card out to you. And so I think at this point, I will turn it back over to Lisa.
Thank you, Ms. Kim. Well, I'll say this, you know, at the Maternal Health Network, we're constantly learning. And I think what we learned from this experience is that maybe the bingo exercise isn't one to duplicate. So we will learn from those efforts, but we will also give you guys an opportunity when we break for lunch to fill out an evaluation. You know, we're always seeking to expand our learning and to provide you guys with the best experience. And so please, if you have any feedback about what that experience was like for you, we would love to hear of it. And then I would just remind you, if you have any technical difficulties, of course, reach out to Sierra and she can provide that support throughout the day for you. Okay, so with that, we're going to go ahead and get started on sharing with you guys some of the good news about the efforts that we have made on our strategic plan short-term priorities. And so the first one is our sort of signature area of support, and that is really providing assistance to the perinatal equity initiative that's going on in San Bernardino. Okay, so you're going to see this format throughout the morning, and this really gives you guys kind of the milestones or the major accomplishments that we have laid out in our action plan for our short-term priorities. So the first priority is support for the perinatal equity initiative. And I want to let you guys know that, you know, when this became a priority for the network, we went to the Black Infant Health Project and Elizabeth Sneed-Berry, who is with us and who will be joining us momentarily to share a story. But we asked her, we said, Elizabeth, what could we do as a network to best support PEI? And she said, you know what the network could do for us, Lisa? They could help support our messaging. We're developing a media toolkit, and if you guys would push that messaging and support your membership in pushing out that messaging, that would be really helpful. It's helpful in helping people understand both the value of addressing maternal health outcomes specifically for Black and African American families, but it's also helpful in helping them understand what resources are available to them. So we have done that, and I'll share with you how we've done that. She also said, really pushing out our service information, right, through the website and our social media sites, adding our events to the community calendar. If you were able to navigate the Maternal Health Network website, you'll see that we have a community calendar there. And not only do we include PEI information, we include any information that we receive through our membership. And then the last thing, they said, you know, we're going to get together, we're going to do a survey. We said, we're going to do a survey as well. How can we collaborate on that? So I'm going to tell you a little bit more about each of these and how we've made gains here in the next couple slides. Okay, so that first area, really promoting the PEI Media Toolkit through the website as well as our social media sites. So we had actually developed some custom content. So they were working with a communications consultant, but we didn't want to wait, right? We said, let us develop some content, let us start pushing out this messaging, and we'll transition to use of the media toolkit when it's available. So we actually developed some custom PEI and Black Infant Health content. We posted it on the MHN website and our social media sites, and you guys can go and you can pull those out, you can customize that, and you can also actually use our custom content. But we also distributed, you know, our custom content through our newsletters. So that weekly newsletter that Katie's so great at sending out, we said, please make sure to access this and support our efforts with PEI. And then, of course, we do promote the PEI work. We do it through our website. We've developed a custom page that Kim shared with you. We are and pushing out through all of our social media sites. We have LinkedIn, Facebook, Instagram, and I'm forgetting one, but we'll go through that.
Sorry, Lisa, Twitter.
Twitter. How could I forget being Twitter-related? Okay, thank you very much, Ms. Katie. Let's move to the next slide. Okay, so if you guys were able to navigate, you might have seen the PEI Media Kit because it actually was in your bingo card. And so this is what the Media Kit actually looks like. And a couple of metrics to share with you guys. We have 11 page visits so far. That's pretty good because it's a relatively new addition to our website, but we're hoping to see those metrics go up as people become aware that they can actually access it through the website, the maternal health website. We've had 77 downloads of the toolkit through our weekly newsletter. And on social media, we've had 78 engagements, either likes, shares, or comments related to the PEI toolkit. Okay, so the second area was really promoting the services now. So you're going to learn a little bit in the afternoon about the services that are getting ready to roll out through the PEI funding, but we wanted to make sure that folks knew about not only the services of PEI, but also the Black Infant Health Program. So we work with PEI to actually develop a link to connect programs to PEI programming. That's going to be offered in the afternoon session. So if you want to know how you can actually refer families to PEI and the Black Infant Health Programming, please make sure to join my breakout in the afternoon session where we actually will walk you through that process. And then we also develop content which really encourage enrollment in those programs. So again, we will walk through that in the afternoon session. And then the third thing is that we have begun posting things to our community calendar. So one of the things that is unique about the Black Infant Health Project in particular is that folks can only register after the cohort has started up to the third class session. So it's really important for folks to get enrolled within that window of time, either before classes begin or within that first 3 class offerings. And so we have begun to post that and we push it out through our community calendar. And then the last thing that I had mentioned is we collaborated on data collection efforts. So as we were exploring the concept of, okay, should we reissue the consumer survey? We wanted a larger data pool. We wanted to be able to really kind of understand how, you know, the consumer experience relates to social determinants of health. PEI and Black Infant Health reached out to us and said, well, we're actually going to be doing some data collection as an element of our work. Could we potentially collaborate? And it was a marriage made in heaven. And so we actually worked with them to revise the consumer survey. We met with them throughout the data collection process to brainstorm how we could maximize the participation in that survey. And then we will be providing the raw data to PEI and BIH for their programming purposes moving forward. So with that now, I would like to introduce Ms. Elizabeth, who is the manager for the Black Infant Health and PEI programming out of San Bernardino County. She's going to share with us a success story that really demonstrates the value of these critical programs to families in San Bernardino County.
Good morning, everyone. Yes, I would like to share this family story to show you just how important your impact is with the BIH program. This mom said, at the beginning of my pregnancy, I was in a rough patch. My husband and I were not as prepared for our first child as we thought we should have been. I was labeled a high-risk pregnancy and forced to switch medical teams. A social worker at my doctor's office noticed that I was having a hard time and referred me to the Black Infant Health Program. While in the pregnancy portion, which is the prenatal portion of the program, I learned about diet, postpartum depression, and a variety of other things. These things were helpful, but the counselors going above and beyond the call of duty to be there for me was the best part. Even in the second half of the postpartum classes, the community and knowledge given still surpassed my expectations. The gifts were great as well. I needed something or someone I could relate to and trust as a Black woman going through her first pregnancy. This program was exactly what I needed. My son is happy and healthy today, and a very large part of that miracle is credited to this program and its outstanding staff. So as part of our collaborative, I want to thank you guys for being part of this family and sending them to us. And so we want to continue to collaborate with each and every one of you that we are allowed to be able to make this impact. Each person in this program actually has a family health advocate that's assigned to her to help her navigate her pregnancy. So I'm really thankful to this family, and I'm really thankful to the provider that sent her to us. So thank you.
Thank you, Miss Elizabeth. So now I'm actually going to hand it over to Miss Katie, and we have another activity for you guys to do. I hope that this one is a little bit easier than the bingo card. Miss Katie, you want to take it away?
I hope so too, Lisa. I'm sure everyone hopes so. Okay, so because we have a captive audience, we thought we could actually move the needle even further on this initiative by doing kind of a social media blast. We're going to do it concurrently because this requires you navigating the website, but we also just want to kind of deepen your knowledge about where resources lie in the website so that way you can easily retrieve them. So I'm going to walk you through the instructions as we go along. We will also be entered into a raffle for a $25 gift card if you post one of the PEI social media toolkit posts to your either personal or organization social media platforms. Whichever platform you have is perfectly fine. We've embedded a hashtag in the post language, so that way we will be able to easily retrieve who has posted and enter your name into a raffle. First thing first, I'm going to post the website page into the chat. I'm also going to post these social media sharing instructions that Miss Sierra put together for you all today. But as we go along, I am going to actually share my screen and walk through this activity with you to help guide you through this. We'll also note that you'll be able to do this by, I think by the end of lunch, let's say, in accordance with our bingo card as well. So if you can't log into your social media account right now, that's okay. Before the end of lunch, if you do it, we'll go ahead and get the metrics for the hashtag and be on our way. So I gave you the cheat code for the actual web page, so you don't have to go to it. But this resource lies under the provider resources page on the MHN website. So you come here, you see this beautiful page, and you're going to start scrolling down about midway through. And here we are. You see the Black Maternal Health Equity Campaign Social Media Toolkit. Now there's a couple of things for you to download. This is the actual toolkit, but what we did for the purposes of today and for your ease of use moving forward is we pulled out the individual social media posts within the toolkit. And so if you navigate to this part of the web page, again, about halfway down, and you click on a page, you will see the post. You're going to have to download this information by using this little download button up here and copy the post language. Everything you need for this post is ready-made for you. You download the PNG file, again, by clicking this download button off to the left. You copy this information, you hit post, and you just had a social media post for your day. We know best practice says that an organization's social media really ought to be active between 5 and 7 days a week. And so this is a really great way to get content out and support the PEI. Okay, I'm going to go ahead and stop sharing my screen, and we're going to offer you about 3 to 5 minutes just to navigate and ask us any questions. But again, you'll have time to work through this until the end of lunch. If you have any questions, shoot us a chat. Contact Sierra in the chat as well, and we can help you get entered into this raffle.
So as folks are doing that, Miss Katie, I just want to say, this is us trying to make things as easy as possible, right, for our members. And so we're always looking for feedback. If there are, and we're going to ask you questions throughout the day. You will have multiple opportunities, right, through the evaluation, when we do our breakouts, where you'll see that there's always these questions about like, well, what could we do better? Like, how could we support your efforts in an easier fashion? And so this is just one way that we've tried to make helping and supporting the PEI as easy as possible for our membership. But if folks have any other ideas about how we could make this more streamlined and easier to do, we're always open to hearing that information.
I think as folks continue to do this as well, and we'll move on shortly, knowing that you guys do have a bit of time during lunch to get this done as well. Just want to put a soft plug for our social media for MHN, in which you can always, if you're looking to promote the PEI, we have multiple posts a week that push PEI content that we would just encourage you to share. Again, it's an easy post for you guys. It's ready-made, it pushes this initiative forward. And again, like Lisa said, it's really to just offer you a resource that then can forward your goals as well. So I think folks have had a couple of minutes. I would just invite folks to ask any questions in the chat, and we'll be able to help you along the way. If you need that social media sharing PDF sent to you via email, we can more than readily do that. So if you need that, put your email in the chat. Otherwise, just put a big help in the chat and we'll be able to get to you. We want folks to be able to participate in this raffle. And with that, I think we can move on.
Yeah, and I think that you're going to talk a little bit about our own community education efforts, right, Ms. Katie?
I am. It dovetails nicely. It's like the Katie show right now, just Katie for a little bit, but not for too long. All right, so Megan, if you can forward the slides, please. We're going to talk about these two kind of concurrent efforts around our community education and info dissemination. This encompasses 5 action planning elements, 3 of which we've made forward progress on over the last year, and 2 of which we're going to continue to really dig our toes into in the next 12 months. So if you hang out with me in our afternoon breakout sessions, you'll be able to participate in kind of the conversations about what that's going to look like. But for now, we're just going to review and really celebrate the great things that we were able to accomplish this last year together. Okay. In order, you'll see 1 through 5. Again, we accomplished really 1 through 3 to either a complete degree or somewhat made progress on. So we launched the MHN website, which you all are now very familiar with and will continue to be familiar with throughout the day, as well as our social media. We established a best practice communications toolkit, which is available on the website. You may recognize that from your bingo card. We'd like to thread the needle throughout the day. We have also been developing education bundles. So the first 2, we kind of checked the box, right? We did some presentations for you about walking you through that and those 2 resources. And now we're really getting our feet wet in these education bundles that are really toolkits for you as providers to communicate around various topics with families. And then the next 2 that we're going to look into more in the coming months will be developing media campaign messaging and distribution of media campaign collateral. So there are really exciting ways that we're going to start engaging with families regarding the topics that you as the membership have told us are most important. So those are listed at the bottom: healthy habits, maternal mental health, and self and baby care following delivery. That's what we heard from you at our Action Planning Summit as the most pressing issues that we really need to craft messaging around. Okay, so at a high level, in Kim fashion, we're going to go through kind of what we accomplished. So those 3 items. The first is the website and the social media sites. So this launched in early 2021. It was a labor of love and continues to be one. I think the website has grown so much larger than we could have ever envisioned and is just such a great resource. So we encourage you to provide us any and all feedback on how we can continue to optimize that for you, as well as our social media. Sierra is our social media czar and she does such a great job. And so we encourage you to follow us because our posts are leverageable for you as well. Then we also, as probably all of you know, get a weekly email blast from me. And I know that it's redundant. We try and be cognizant that we don't want to inundate your email. But that weekly email blast is really a conduit for network members to share information with one another as well. We also promote our individual membership goals within that newsletter. So it's got a lot of great information. Okay, the next is the communications toolkit. Again, this is available for download on the website, and it has so many components. Kim did such a great job putting this together for you all. And it's really just a toolkit for you as providers, for your organization to understand communication best practices, have leverageable material. There's a resource kind of appendix where you can click on it and find all of these great mediums to help you create your own content. And again, a plug for my afternoon breakout. Text messaging is coming in the next year, which I think is just so exciting. Okay, the next one. Oh, actually, this is it on the website. I apologize. What the communications toolkit looks like. If you're unable to find this on the website, as with anything, you have our email. And so just reach out to us and we're happy to share this information. We know that there's just a wealth of resources on the website. So if you ever need a resource, you know it's out there, but you just can't navigate to it, we are happy to share it with you.
Can I see the previous slide, number 2?
Yeah, absolutely.
Thank you.
And so on this slide,
Okay.
I didn't really go through it, but there's about 6 components that are currently developed in that communications toolkit. Again, it really highlights best practices in communications and great resources in the appendices as well to help your organization craft your own communications.
And I think that, can I add something, Miss Katie? So I think that, you know, what we want to do, again, in our efforts to make this as easy as possible for everyone, we know that not all organizations have like a communications manager, right? So this is really meant to support all levels of organizations. And so access the toolkit, it'll tell you, yeah, when you do email communications, like here are some best practices that you should just be aware of. We actually use our own email blast as an example of how we too follow those best practices. So, you know, not only are we providing the toolkit to you as a technical assistance factor, but if you have any other sort of technical assistance needs in utilizing this toolkit, please feel free to reach out to us. Again, we're here to help you.
Absolutely. That was a great addition, Lisa. Thank you. So the third component that we really started making headway on in terms of this effort were the development of the education bundles. And this, again, like most things that we do, is a labor of love. And it is reliant on you as the membership to create a streamlined set of education materials around a specific topic that you, the membership, told us as important. And we gather information from you as the subject matter experts in the field about what the 3 most important things are around those topic areas and create an entire bundle of information that you as a provider can leverage, co-brand with us, and talk to families about it. So that way we have a streamlined, consistent messaging around important topics. So families start to hear the same important things and it starts to change their behavior. We're going to dig a little deeper into one of the 3. You'll have an opportunity to view one of the 3 bundles. These are also available on our website. So we'll talk a little more about that. Before we show you kind of the best part, or at least what I think is the best part of these bundles, I do want to tell you that there are, on the next slide, you'll see the topic areas aligned with a month of the year. And so wherever possible, if there's a National Awareness Month for nutrition, we want that bundle to be available at that time of the year, and then it'll be cyclical. And so these bundles will be available for you. There will be 12, and you will be able to leverage these materials, post it on your social media, do presentations with family or other staff members, and again, try and create some consistent messaging across our 300 members now. So without further ado, I think we will preview for you one of our most trusted members who did a video for us for one of the bundles regarding breastfeeding. Hey, Megan, I'm not able to hear it.
I apologize, Katie. It was, I'm not sure what to do about the audio on my end, but clearly it's not coming through.
I think if you leave yourself unmuted, perhaps we can try it that way.
Yeah, let me go ahead and do that.
Hello, everyone. My name is Kanisha Neal. I am the breastfeeding coordinator with the San Bernardino County Department of Public Health Women, Infants, and Children Program, otherwise known as WIC. And in my experience, what makes families most receptive to information about breastfeeding is just transparency. Sharing the information, being very honest about the common barriers that they may experience along the way, and in listening to what they have to say about their thoughts and feelings related to breastfeeding, and crafting the information that you share around what their goals are for them, their family, and their family's health. The most important thing that a provider needs to consider before talking about breastfeeding with families is they need to understand that people come to the table with their own experience, their own lived experiences, and they may have sometimes tried breastfeeding and it did not go well for them. So we need to come to the table with lots of empathy, lots of understanding. And we also need to have our own knowledge base as well. But there's also knowing that there's no shame in letting your families know when you are not sure about the answers to their questions. But what is important to know is who you can reach out to find the answer to their question. Being able to respond timely to these families is going to be very important during this time that they're deciding on how they would like to feed you. What do educators and presenters need to be aware of when discussing breastfeeding with families? Breastfeeding is, although it is very natural, it is also very taboo. It's also a situation to where there's a lot of sexualization that happens with the breast. So you may have folks who are uncomfortable. You may have folks that make jokes. You may get the gamut of things when talking about breastfeeding. So you just want to be prepared for anything. You want to be prepared for some embarrassment. You want to be prepared for some jokes, or maybe even being very uncomfortable because they've had previous experiences with breastfeeding that did not go the way that they planned, and they have a lot of grief and trauma associated with it. So you want to be prepared for the gamut of emotions when you are talking about breastfeeding. All right, so are there cultural or historic consideration providers need to know? Yes, and it varies from person to person. You don't want to make the assumption, although there are certain groups who may think things like colostrum, the early milk, should not be provided to the baby and should wait until there's an increase in milk volume. You have some folks who feel like the American way of feeding infants is formula, so breastfeeding is not the thing that Americans do. So if you have folks who are immigrating to this country, they may feel like the only way for them to assimilate is to formula feed so that they don't stand out. And then you have some families that have the historical context of their ancestors being forced to wet nurse little ones. So there's a whole host of things that people may be coming to the table with. So you don't want to put those things on people. You don't want to make the assumption. So just be ready to create a safe and open environment so that folks can share with you how they are feeling about the topic so that you can respond appropriately. But there are a number of cultural contexts that can come to the table when you are discussing breastfeeding.
All right, well, I would just offer, Ms. Kanisha is here, so if you want to give her a hand in the chat, I think that is such a value add to these bundles or these videos that will be able to be leveraged in a number of ways on your websites, on your social media, in your waiting rooms. And we're going to talk a little bit about that on the next slide. There are all of these materials, all of the bundles, the 3 that we'll be going through today are available on the website. And as the bundles become developed in accordance with those months, right, that schedule that we looked at briefly, they will become available for download on our website. Okay, Megan, can you go ahead and change the slide? I'm not sure if it's on my end.
Hello, everyone. My name is Kanisha.
There we go. So again, we are going to go through these in a bit more detail. We have 3 bundles that are completed, and we're going to do a little bit of engagement with you. We want to show you all of the resources that are available in these bundles. So again, it's the flyer, the agenda, a PowerPoint with facilitator notes. So you as a facilitator who's talking with families about these have a script from what subject matter experts in the field want you to convey to families when talking about things like breastfeeding, right? So on the next slide, we're gonna give you some instructions. We're gonna break out into 3 breakout rooms, and you're gonna have one of us SEI folk be in the room with you. And we're gonna present to you these bundles. So you're gonna be able to self-select into a breakout room of the topic that you're most interested in. So that includes breastfeeding 101, creating a safe home for baby, and maintaining healthy relationships. We're then gonna just ask for your feedback. We wanna hear from you, how do you feel about these? How can we help you make these a valuable resource for your organization? Okay, so Sierra, are you able to send us into some breakout rooms?
I am. And then for everyone still in the room, this breakout room is self-select. So let me know if you can't see the breakout rooms, or if you need me to assign you to one, I can do that as well.
Hello, this is Beatrice Vasquez. I would like to join the the home, safe home for baby. I didn't know how to select it.
Perfect, I'll do.
Yes, they're under provider resources. So if you go to events resources and scroll down provider resources, you'll see the community ed bundles are kind of like halfway down the screen.
Great, thank you.
Thank you, Miss Marika. I couldn't unmute quick enough. You beat me to it.
Okay, I think we're all back together, yes. I don't know about my fellow SEI folks, but I'm long-winded. So we went a little over, but had such a great conversation. So I'd like to hear from the facilitation teams. Lisa, maybe we can start with you. What happened in your room?
Yeah, and I'm gonna let Marika speak to that because she was my excellent note taker.
Yeah, I think the biggest thing that came up for us in our room was this need to actually translate the material. So we so appreciate Terry from Riverside Community Health elevating the importance of us needing to translate the materials at least into Spanish and provide, you know, subtitles, et cetera. I think that was probably the most exciting thing that came out of our discussion.
Absolutely. So we will work double time to get those that are already posted to the website translated. And then as we work through the remaining 9 that are in development, we will concurrently develop both English and Spanish content.
That is a great suggestion. I love that. All right, Kim, Emma, what occurred in your breakout?
I think if you want to go first, Emma, and then I'll go after.
Emma, do you want me to jump in?
Ellie,
or
why
are
don't you
do it?
Sorry, I thought you said you were going to do it, so I was waiting for you to talk.
Yeah, that's fine. I can do it. When we asked people what questions they had, they really didn't have questions about the bundle. But the question about, are there other ways you might use it, was really interesting. Folks talked about doing refresher trainings for their staff on healthy relationships, potentially doing a train the trainer using the presentation materials. It was also noted that medical students and residents who are really seeing high risk patients should have access to this, and that they could use it particularly to link clients to resources that they need. And then there was a note about the domestic violence component of the healthy relationships, and we had a member who really wanted to dig in and see how robust those materials were, because she could see you know, many uses for them. And we really highlighted that you know, that healthy relationships piece happening in October is super helpful because we know how stressful the holidays coming up in November and December can be for some families. So overall, people said they were very positive, and in terms of supporting the use of the resources, the feedback we got is that the Maternal Health Network is awesome and that people feel supported.
Oh, that's great. Well, Kim, bring it home with our discussion, because I think that'll be a good wrap up.
All right, great. And Katie, feel free to jump in, of course. So similarly, we didn't have a lot of questions from folks about how they could use the bundle, although we did ask people that if they ended up using the bundle in an unexpected way, maybe they could email the MHN and let us know how that went and what they used it for, so that we could spread that. There was a question about if they use the social media sections of the bundle, can they tag MHN? How should they tag MHN? Which was not something that we had really provided, you know, information around. So I think, yes, that would be fantastic if folks could, you know, tag the MHN while they're using those social media posts. It's a great way to spread awareness and link organizations. And then the last question was really around, is there a document that sort of summarizes or covers all the bundles that could kind of provide an overview of maybe the top 3 things for each bundle and kind of give a sense of what's included? And we said, no, that doesn't exist, but if that would help support your use of the resources, that's definitely something we could look into. Just with the caveat that because it's going to take us the next 7 to 9 months or so to build out all of the bundles, it's likely that we won't have that in the short term, but we can definitely add it to our list of things to do in the midterm. Katie, anything I forgot that you want to jump in with?
No, I think you covered it. I think we'll go ahead and hand it off to Lisa for our next section about provider trainings.
Well, thank you guys so much. You know, this is the part that I love about the Maternal Health Network, and it's that, you know, we're constantly learning from you guys and making adjustments. So I'm already thinking about all of the adjustments that we need to make to the community ed bundles. So thank you guys for your thoughtfulness and your input on that part. Okay, so our next short-term strategy is really around provider trainings and that workforce development component. So really quickly, there were 4 major elements. I'm going to go through the progress that we've made. We've actually made progress in 2 of these 4, and we will complete and dig our toes in. I liked how Katie said that earlier, on 3 and 4 over the next year. So why don't we go ahead and just briefly go through how we've supported these efforts today. So the first thing you guys said, it would be really nice if we had a listing of providers who actually provide trainings in the areas where we have identified our focus. So the Maternal Health Network said, you know, the workforce in general needs to be competent in these 3 areas, one being implicit bias, the second one being cultural competency, and the third one being social determinants of health and how they actually impact maternal health outcomes. So we searched and we searched and we found resources that, training resources in Southern California, 15 that address implicit bias, 14 that address cultural competency, and 6 that address specifically social determinants of health. There are only a couple of resources that actually hit all 3 areas. You can find that on our website. And then the second area where we've established a mechanism, is I think how I would like to frame this, is we have created a training calendar that you can find on our website. And the intention there is that if a network member is actually providing a training on one of those 3 training topics that I just described, and there's excess space, so you have room for 30 people, you only have 20 staff members who are planning to participate, you have extra space for 10 folks who could co-participate in this training that your organization is offering. We've asked you guys, hey, let us know and we'll post them on this training calendar, and then the whole membership would have the option of being able to connect with you and access that training as a courtesy of a fellow network member. So we've hosted this on our MHN website. We do have a question that we're going to pose to you guys at the conclusion of this particular section of our agenda, which asks you, is this valuable? Is this something that you guys still want to see us support? So we haven't had a whole lot of inputs in regards to this particular issue. Okay, so with that, I'm going to ask Sierra to go ahead and post the poll. Have you, or do you think you will use the provider training compendium that I described in the first portion of this section? So I see some folks are answering. You know, we always like to get like 80 to 90% participation. We're at about 40% of the folks have logged in and let us know. Give folks a couple more seconds. Okay. Maybe about 5 more seconds and we'll go ahead and close the poll. All right, so you can see here. Well, I don't know actually if you guys can see because I got an error screening, but I'm going to just verbally share with you the results because I can see the results. About 89% of those that actually answered the poll, which were 31 of you, you guys said yes, you either have used or you will use it. There were a couple of people, 4 folks, who said, no, I don't think I'll use it. If you don't think you'll use it because you just don't see yourself providing those trainings, I completely understand. But if there is a way that we can make that more useful to you, again, please feel free to reach out to us. We're here to help you. Okay. And with that, we're going to go on to our next one. And this is going to be like super fast because when it comes to proactive screening and education, and you can go ahead and advance the slide, Miss Megan, we have 3 major milestones, but these actually won't launch until July 1st. So there has been no progress made, but that was intentional. It wasn't intended to actually start until July 1st. When we do that, we will be establishing proactive screening briefs that address both healthy habits as well as behavioral health and risk screenings. If you want to find out more about what we plan to do, I would encourage you to go to that breakout. with Miss Kelly in the afternoon session. Okay, so we have a scheduled break. You can see that the slide says, please return to your computers at 11. It is exactly 11 right now. So I'm going to just say, please return to your computers at 11:05. We're going to take a really quick 5-minute break and then come back, and then Kim is going to share with you some data from our consumer survey efforts this year.
I'm back. You're on mute.
Well, welcome back. I was just saying, welcome back. And I'm going to now hand it to Kim, who's going to present data on our consumer survey data report. And this is like literally hot off the press. Yeah, Kim?
It is. It is. So I believe that everyone got this report, got the actual PDF of the report in the meeting materials yesterday. If you didn't receive that, it's also available on the website, which I hope that you found as you did the bingo. If not, if you are looking for it, just put a request in the chat. We will provide a link along the way about where you can find it. So as before we talk about the 2021 survey that we conducted and produced the report on, we want to kind of give a little bit of background. So where did this start? So in 2019, the MHN opted to create and distribute a survey as part of the strategic planning process. So they really wanted to gain information about the experience of consumers in San Bernardino County, so consumers of the Maternal Health Network. And through those activities, the survey distribution and collection, 154 surveys were collected basically in summer of 2019. If you're interested in seeing that report, that's also available on the website at the link that Katie has put in the chat. So building upon that, in 2020, there was discussions around some key leadership and membership members, MHN members, who said, you know what, I think we should do this again. I think that having more information is really going to help with ongoing quality improvement efforts. And so in 2020, the network embarked upon a process to relaunch that consumer survey. Now, through those efforts, 253 surveys were collected between August of 2020 and April of 2021. I know those numbers may look a little low compared to what was collected over a summer in 2019, but remember that this is pandemic. So this was during the pandemic, and we're going to talk in a minute about what that meant for distribution. So as we continue on, what we did first is we worked with you to refine the survey tool. So we said, okay, key members of this planning team, so Cal Baptist, specifically Dr. Flores Carter, and then key members of the Black Infant Health Project, Elizabeth C. Berry and David Pratt, as well as other members of the Maternal Health Network, participated in refining that survey. If you remember, we actually sent out a survey to memberships in May of 2020 and asked you for your feedback on the questions and if there were additional areas of inquiry that you were interested in. Based on that, we developed a 27-question tool that was designed to explore the following areas of inquiry. So what are the risk factors reported by pregnant families in San Bernardino County? What are the correlations between social determinants of health and the maternal health experience in San Bernardino County? And what do consumers identify as opportunities to improve quality of care within the system in San Bernardino County? And as we go through the results today, you'll see that we've actually are presenting them according to those three areas of inquiry. But before we jump into the results, some more notes on distribution. As I mentioned, this was the COVID year, and so that really did impact survey distribution. Originally, it was intended that research associates or assistants at Cal Baptist were actually going to distribute the survey in person, and in some ways, help people complete it, collect it, all of that. Due to restrictions, that wasn't possible. We also weren't able to distribute the survey in key areas that we thought we were going to. So specifically WIC offices. Those were not open for any survey distribution or research endeavors during the pandemic. So just to give a sense of what we were able to accomplish during the pandemic, I do want to give a special thank you and shout out to those survey distribution sites that were able to assist us with survey distribution. You can see them on the slide there on the right. And so thank you so much. In addition, the surveys were distributed electronically via posts on social media and other websites. And so we are very grateful to everyone that assisted with survey distribution. Okay. So as you go through the PDF, you'll see that there are methodology limitations and consideration sections, as with any report, and I would encourage you to read through those on your own to get a sense of what we can and what we maybe shouldn't say with the data that's being presented. But one of the things that we really wanted to do, particularly around those social determinants of health questions, was to disaggregate the data by key areas that were identified by membership as being important. So things like, does the experience differ for folks based on their race or ethnicity? Does their experience vary based on their insurance coverage, based on their poverty status, based on a variety of different criteria? What I can say is that because when we disaggregated, in many cases, the ends became so small, we didn't present all of the results that we found because we didn't find them to be particularly meaningful, or we didn't want to generalize to a larger group using such small sample sizes. So even with the results that we are going to present disaggregated, please, think about the ends and keep that in mind as you think about generalizing to larger population groups. But what we were able to do is, in a few cases, find what we thought were meaningful results by race and ethnicity and by insurance coverage. And we're presenting those in accordance with the MHN's focus on equity to really see, are there areas where improvements can be made to increase equity within the maternal health experience in San Bernardino County. All right, so let's jump into it. The first section, who completed the survey and what's their sociodemographic profile. Part of the reason we want to provide this is because these are areas where the data could be sliced if there was an area of inquiry. You could disaggregate the data by, for example, pregnancy status. So we asked respondents to identify a category that described their pregnancy status. You can see here that the majority of survey respondents were currently pregnant, so about 60%. We also had about 28% that had recently delivered within a year, 6% planning to get pregnant, and then 7% who are a family member. So if you wanted to look at a particular group in accordance with some of the questions, you could do that. Unsurprisingly, given what we see here and the focus of the survey, the majority of individuals who responded did identify as female. So 98% of respondents to that question identified as female. Okay, so we're going to go through the demographics pretty quickly so that we have more time to spend on other parts of the areas of inquiry. So you can see here that Hispanic or Latino individuals did represent the largest group of respondents. They weren't a majority, but they were the largest group at 45%. You can see as well that in the legend there, we are providing you with the percentage of the San Bernardino County population that group represents based on census data to give you a sense of how representative these respondents are of the general population. And if you go on to the next slide, you'll see that we did the same thing for city of residence. So to give you a sense of where were folks completing or responding to this survey. And you can see that again, in the city names at the bottom, we've provided the percent of SBC population that lives in that area. So if we were to call out, for example, San Bernardino City, you'd see that according to census, is 10% of the SBC county, and it represented 24% of the respondents. So you can see not an exact match there. Others are much more proportional. Right? Next up, education level. What you can see here, if you combine all the folks who had indicated they had completed at least some college, you'll see that the majority of respondents, 67%, indicated that they had completed at least some college or more. And then if we look at health insurance, you can see that in this case, almost everyone responded that they have health insurance. So 234 out of 251 respondents, 93% said, yes, I have insurance. So that made it a little difficult when we wanted to disaggregate some of the questions by if folks had insurance or if they didn't. So that was a little bit of a limitation. Although it's fantastic that so many people reported that they have insurance. That could also be linked to where people were accessing the survey. In terms of hospitals, clinics, things like that. All right. Now, if we look at household income, you can see that the respondents, kind of their they fall on one or two sides of the spectrum for the most part. So you've got 48 individuals who responded that their household income was less than $12,760 a year, and then 54 who said that it was greater than 61 or 60,921 per year. What we were able to do, because we also asked folks about their household size, is we were able to look at poverty guidelines and see how many of these households were actually at or below the poverty line. And we found that 35% or 68 respondents that answered both questions with the correct data that we needed actually are at or below the federal poverty threshold for their household size. Okay. And then as we kind of wrap up the demographic section, we did want to provide some information on what provider types respondents indicated that they had been utilizing. So you can see that the majority of respondents did say that they had indicated that they had utilized an OBGYN. That's followed by other doctors. So it looks like respondents were, for the most part, indicating that they were utilizing doctors. And then as you look at other options, nurses, midwives, PAs, doulas, other providers, you can see that those percentages decline. Now, this is one of those cases where we actually did disaggregate, and we thought this is really interesting. Are folks utilizing different types of providers based on their access to insurance? Now, again, remember that our N is very small here. We only had 11 folks that both answered the health insurance question and the provider type question. But what we saw is that those individuals who did not have health insurance only used doctors. So they never reported that they used a midwife, a PA, a doula, or any other kind of provider. So that may indicate that they're not utilizing the full spectrum of services available to them within the county. Again, we know the N is very small, so we want to be careful about making generalizations. Okay, so to kind of wrap up that section, and I promise you'll have like more concrete conclusions and summaries in the other sections. But in this case, as I mentioned before, because some of those N's were very small, we only wanted to present results that we thought were kind of meaningful and not overwhelm you with just a bunch of data that may or may not speak to questions that you're interested in. And so what we're offering is we have the raw survey data. And if that is something that you are interested in utilizing, that is available upon request by emailing the MHN email, which you can see at the bottom here. And also, if you go onto the consumer survey report, if you can't remember after this meeting, oh shoot, how do I request that data? You can look in the report. It's on, I believe, page 3. It's either page 2 or 3, where we say this is how you can access the data. And we also have it on the website, the request for data, not the actual data, because the data is only open to MHN members at this time. So we'd ask that you email us and say, let us know how you would be using the data, because we'd love to understand how people are going to use this survey. Okay, so let's get into the next section, which is risk factors. So one of the areas of inquiry was, what are some of the risk factors reported by pregnant families in San Bernardino County? And so we're going to start with a very busy graphic. And so for this one, I'm just going to take a moment and give you an idea of how to navigate this figure in the report rather than summarizing it for you. So what we've done here is we've looked at, we asked a question about what are the barriers to accessing services that respondents are experiencing, and what are the extent to which those issues prevented them from accessing care? The results of this figure are related to the second part of the question. So what is the extent to which the issues presented here prevented folks from accessing care? And what you can see is that insurance not covering needed services, lack of funds, lack of transportation, lack of knowledge were the biggest barriers to care. You can see that by how far out the bar goes, as well as the N that's included in the kind of the legend there. But what's important to look at as well is how impactful that was to folks when they were trying to access care. So if you look at it, you'll see that the dark maroon bars indicate the number of folks that indicated that that barrier always prevented them from accessing care. You can see that, for example, I think a good one to point out would be lack of transportation, which is about midway down in the support category. You can see that 13 folks said that lack of transportation resulted in them never being able to access care. Another 11 said that that challenge resulted in them rarely being able to access care. So we just want to make sure that you're looking at both the how many folks said it prevented access to care and how impactful that barrier really was.
May I add something? The survey for the insurance, I think it would be more accurate if it was based on not if you have health insurance, but type of insurance. Because some health insurances are limited on what you have access to. Like if you have a specific, like a maybe, I don't know if like a government assistance health insurance versus like if you and I get it through like our jobs or something like that, or personal PPO or HMO like Kaiser, the care is a little bit different. So it's like sometimes you don't have access, or our clients may not have access to some of the service that the better insurances have. So I think the survey should probably, or maybe do a resurvey about not if you have it, but what type.
Right, and that's actually a really good thing to point out. Thank you so much. I actually couldn't see who was saying that because my spotlight is on.
Oh, Loya Smiley from El Sol.
Thank you so much. That's really helpful. And we actually did collect information on the type of insurance that folks had. So that would be an area where if there was a group within the membership that thought, I'd really like to explore the different types of health insurance and the impact that had on the experience as represented in these questions, that's definitely something that could be done.
Thank you.
I will just say as a preview, one of the afternoon breakouts is going to be, what should we do next to collect data? What should we think about as we consider collecting more data? So I hope folks will consider joining that session this afternoon and providing more great feedback like what you just provided. Okay, so now remember, we're still in the risk factors section. So we talked about barriers to service. What we're looking at now is whether individuals who either during their pregnancy or after pregnancy reported that they had the emotional and practical supports that they needed. So if you look here on emotional supports during pregnancy, you can see that about 51% said that they always had the supports they needed. If you look at after pregnancy, 47 indicated that they always had the emotional support that they needed. And let's go down to the next slide, because we are going to talk about that more in the conclusions. And so if we think about practical supports, so that could be things like transportation, diapers, things like that, practical supports you need during and after pregnancy. You can see that again, about 50 to 60% of respondents were indicating that they always had those supports after pregnancy, versus you have between 4 and 6 saying never, and about 11 and 21 saying sometimes. We are going to circle back to that in a minute. We also asked about other risk factors. So we asked survey respondents to indicate if they experienced any of the following conditions within a year prior to pregnancy. And you can see that of the 104 respondents that provided at least one answer to the question, 15 said that they had experienced diabetes, 10 had experienced hypertension, and 49 had experienced obesity. And one thing we just want to point out here is that this question just asked them to say if they experienced any of these. There wasn't an answer that said, no, I did not experience any of these. And we also know that folks are sometimes hesitant to disclose information about their medical or other personal factors, which you'll see on the next slide. And so these numbers really should be taken as a minimum rather than trying to use them as some kind of percentage of the total. So if we look at the next, you'll see that then here, we asked about risk factors that are either experienced by the survey respondents or present in their household. So we asked specifically about mental health issues or depression, substance use or misuse, and violence or trauma. And you can see that in this case, mental health issues or depression was the most commonly provided answer, followed by substance use or misuse and violence or trauma. Now, these answers were not mutually exclusive, so individuals could opt from 0 all the way to 6 of these different risk factors if you combine the medical ones as well. And what we found was that 65 people reported that they'd experienced one of these, and then 39 had experienced 2 or more of these risk factors. So we did have some co-occurring risk factors being reported. All right, so to summarize our risk factors, consumers face a number of barriers to accessing services in San Bernardino County. I encourage you guys, especially as service providers, if you're looking to mitigate those barriers, to review that table in more detail to get a sense of how impactful those barriers are throughout the county. We also saw that consumers do not always have the emotional and practical supports they need during and after pregnancy. So while about an average of about 50% were responding to each question that they always had the emotional and practical supports that they want, that means that about 50% didn't always have the emotional and practical supports that they needed during and after in pregnancy. And so that's possibly another room for area of improvement. And then finally, consumers reported that they experienced a variety of medical and other personal risk factors that could impact a healthy pregnancy. And again, we just talked about those on the prior 2 slides.
And Kim, before you move into the next section,
Sure.
There's just so much data, right? There's just so much to distill from this. But I think one of the things I'd like to point out for our members is that, when we went through this process the first time through our strategic planning process, what we found is that a lot of folks who were in the low income population or who were Medi-Cal recipients were the ones that were most likely not to have the emotional and practical supports that were needed. And so that's just an element that I think is being confirmed by this additional data set. And it opens up like more questions for me, right? Like it does offer, but the data set does offer all of our members to take that raw data and say, well, I want to look at the results of this particular area for just this subpopulation, like just folks who are on Medi-Cal, or just folks who live in this particular community, if that's an organization that's rooted in a particular community. That's available to them through the raw data, yes?
Absolutely. And I would actually say, just to hit on that, one thing that we thought about, but we did not disaggregate by, is that idea of those barriers to service, and then another chart that you'll see in a minute, and whether those changed by geographic area. So that could also be a really interesting disaggregation that somebody could do, or that we can again talk about in our afternoon session about whether the data is being collected in a way that facilitates that.
Right. Yeah, because that's what I was thinking too, Lisa, like that. I think it's the quality of service, maybe based on insurance.
Yeah, so I would encourage you, Leah, to participate in Kim's afternoon breakout, because they're going to get into like, well, what should we do next with this data set and with this, data exploration.
Right.
All right, Ms. Kim, I'm going to hand it back to you.
Okay, so let's go through the last area of inquiry, which is quality of care. So what we were interested in looking at here was, what do consumers identify as opportunities to improve quality of care within the maternal health system in SBC? And then in this case, you are going to see a few areas where we were able to disaggregate this data. So, but to start, what we want to start with first is we asked a question about provider improvements and said, what is the one thing a provider could do or could have done to improve the quality of care that respondents received? And what you can see here is that, providing more time during visits and connecting me to other community resources, and then to a slightly lesser extent, providing more flexible appointment options, were the 3 that kind of rose to the top. But we thought this is one where we want to understand more if this is impacted by an individual's race or ethnicity, if their experience is different. And we actually did find that their experience seemed to be different. And so if you look at the breakout below, which I know is a little bit busy, so again, please look at it in the report at your leisure, what we're seeing here is that Black and African American respondents were more likely than other groups to prioritize provider training on race, ethnicity, and culture as the one area of improvement they would select if they were able to select one. So these were mutually exclusive answers. And so this really speaks to prioritization of respondents. So you can see that there, about 40%, so 21 of the Black or African-American respondents that answered this question indicated that was the area of improvement that they would prioritize. Okay. So this is a separate question, so I want to make sure it doesn't get confused. But another question that we asked related to the impact of race and ethnicity on quality of care is that we asked folks outright, do you feel like your race or ethnicity impacted the quality of care you received? And within this, you can see some, I know it's a little text heavy, but we wanted you to have the context, which is that the majority of respondents to that question said no. So 82% of folks who responded said, no, my race or ethnicity didn't impact the quality of care I received. But 18% said, yes, my race or ethnicity did impact the quality of care that I received. And we then asked them, well, was that impact positive or negative? And what you can see based on the chart here, again, some of the ends are very small, but what we can see is that Black or African-American respondents were much more likely to respond that the impact was negative versus some other groups. For example, if you look at the white group, 5 out of 6 responded that their race or ethnicity had a positive impact on the quality of care that they receive. So again, speaking to possible, equity issues within the system, these are small ends, but we felt like this was an important area of inquiry to highlight. Okay, so moving on, we also asked about proactive supports. So we asked, did your primary care provider ask you questions that could lead to the provision of proactive supports? So we said, did they ask any of these questions? So these are not mutually exclusive answers. And you can see that providers were most likely to ask if folks needed help with breastfeeding. They were least likely to ask if their individual's partner had ever hurt them or made them feel afraid. So that could speak to an area of improvement of providers asking questions that might lead to the provision of proactive supports. Okay, let's keep going. So in this case, we're going to go through this pretty quickly because we asked questions related to what stage of pregnancy the family was in. So we asked, what's the single most important area of improvement for families planning to get pregnant? We asked, what's the single most important area of improvement for families recently delivered? And then we asked a broader question for families that are pregnant. And we said, what are the top 3 things you would prioritize for families that are currently pregnant? So you can see families planning to get pregnant really prioritized information about how to prepare for a healthy pregnancy. That is great because that is one of the communication or information dissemination categories, which is around healthy habits, things like that. So there's alignment there with what the consumers want and what the MHN is producing. And then let's go down to the next question, which is asking about families who are currently pregnant, what areas need improvement? And so what I will say is if you go in the report, this section is very long. We've summarized it for you here. And the areas identified for improvement most often included improved information access and quality when they're utilizing prenatal care through a doctor. Again, the same information access and quality when they're accessing mental health care during pregnancy. And then again, information access and quality when they are accessing prenatal care through a midwife. But again, I would really encourage you to look at the full table, especially if it's within your service sector, maybe looking at the areas that speak to your service sector. Okay, and then the last part of this is quality of care. So we asked families, what's the single most important area of improvement for families following the birth of a baby? I'm only presenting the top 5 here. There was a tie towards the bottom, which is why you've got 2 of the same, or a tie, I'm sorry, there's a tie higher up, which is why you have 2 of the same. And while you see that quality of care during hospital stay following delivery was the top, if you combine the 2 answers that have to do with postpartum depression, which are the 2nd and the 4th, that actually exceeds the during a hospital stay answer. So that speaks to possibly the need to provide more information on postpartum depression to families following the birth of a baby. Okay. And then quality of care, improving the availability and quality of services and support. So we asked folks to identify from a very long list of services and supports, those that they had accessed, and then we asked them how satisfied they were with the services they had accessed. This is a 4-page table. So I'm only presenting a little snippet here so you have a sense of what's provided in that table, so that it's kind of a teaser so that you'll go in and review that table on your own. But I am going to provide you with a tiny summary of that on the last page here. So, summary of the improving quality of care. As we saw, consumers overall prioritized more time during visits and facilitating connections as actions providers can take to improve their quality of care. But we did see that respondents of different races and ethnicities prioritize different areas of improvement. There is room for improvement in how often providers are asking consumer questions that can lead to the provision of proactive supports, particularly around questions that speak to the presence of intimate partner violence. There are recommended improvements provided by maternal health system by stage of pregnancy. So again, I would encourage you to look through those sections based on your service sector and kind of see if there's anything in there that you can utilize as you look at your own quality improvement efforts. And then a majority of consumers reported that they were satisfied with the maternal services they accessed. So that was that snippet of the table I provided above. If you looked, or on the previous slide, if you looked at the whole table, you'd see that consumers indicated they were satisfied or highly satisfied with 19 out of 23 services listed. So we had strong satisfaction across services that were being accessed. What's important about that table to note is that it also indicates if people said that service isn't available to me. That could be a very interesting area to explore, again, by insurance area or insurance type or geographic area. Okay, so we are wrapping up here before we go into an activity that we're going to ask you guys to do. So what do next steps look like? So really, we're thinking about future research. So, we've provided you with some, high-level overview of the data that we saw here. And we think that these do provide a framework for expanding survey efforts to better understand the experience in SBC, particularly around an improved understanding of the impact of social determinants of health on the experiences of individuals of differing backgrounds and life circumstances. However, to do that in probably a more meaningful way, we would really like to see more respondents. And so larger data sets are really needed before we start generalizing that data to a larger population. And so we think future survey efforts should really consider approaches that can increase those respondent rates, whether that's a shortened tool, increased distribution sites. Again, we know that as a COVID year, this was an off year to produce this survey. And so we are so grateful to everyone that participated. Particular shout out to, again, the Cal Baptist folks under Dr. Flores Carter and the BIH folks as well, who really assisted throughout the year with that survey distribution and management. But just as a call out, this afternoon, I will be leading the breakout session that explores possible next steps for data collection efforts within SBC. So if that is a topic of interest for you, I would encourage you to join that afternoon breakout later today. But now you can stop listening to me talk because that was quite a bit. That was like 30 minutes of listening to me speak. So thank you for bearing with me. What we're going to do now is we're going to send you to a breakout room for about 10 minutes. And we are going to ask you to consider the following questions. So are there areas of inquiry that you are interested in understanding that weren't presented in the report? Are there ways that the MHN can support organizations in using this data for future decision-making purposes? So I see that Katie's putting those questions in the chat. You may want to, cut and paste those so they go into your breakout session with you. And we are going to put you in breakouts in just a minute. And then we're going to have you come back and we're going to ask you to report out in the chat kind of your key takeaways from that 10-minute session that you spent with your colleagues. So I'll pause there and check and see if Sierra is ready to send folks off to breakout rooms.
I think folks should be just making their way back to our general session. So we'll give folks a couple of minutes until they're reverted back here without their consent. Thanks for putting that plug in the chat, Miss Katie. We are going to be asking folks to report out anything in the chat based on their discussion with their colleague. We're really hoping that you guys still feel like you're able to connect, even though we're in a virtual setting, by way of these breakout rooms where you get to, you know, chat with other MHN members.
So Lisa, I think we've got all the folks back for the most part.
Okay, perfect.
Okay, so I just want to thank everyone for taking that time and hopefully talking about the questions that are currently up on the screen. We would, like Lisa said, we would very much encourage you to put your general thoughts about those questions in the chat. If you think there's something lengthier you may want to talk about, you know, we do have the afternoon breakout session, which is about data, where we're going to be diving deeper into, you know, some of the questions that align there. You can also always email those to us if, again, you think like, oh, I need to kind of process this and think about it. You're welcome to shoot us an email as well. And so I think that will wrap up our consumer survey presentation, and I'll turn it back to Lisa.
Thank you, Kim. Okay, so we are in the final stretch. We are wrapping up our morning session. And of course, like I had previewed for you guys when I opened up this meeting, we are going to ask you to share with us some feedback. We know that some folks are only able to attend a portion of the summit today. So we want to issue a survey both at the midday mark to reflect upon what you guys thought about the last 3 hours we spent together. We will issue another Survey Monkey at the end of our event to gather your feedback about what you guys want to share with us about the last portion of our summit. So I know Katie is going to go ahead and throw the Survey Monkey link into the chat. If you guys could just take a couple of minutes before you go and grab your lunch and take your lunch break to complete that Survey Monkey. We really do rely upon that feedback to refine our process and make sure that whatever we're offering to you guys has the most amount of value. So please make sure to evaluate our efforts. So before I release you guys for lunch, I just want to take care of a couple of housekeeping items. So I know that there was some challenges in completing the bingo activity that we had earlier today around exploring our MHN website. If you weren't able to complete that and you want to connect with your partner over the lunch break to complete it and then submit it to be included in the raffle for that $25 gift card, what we'll ask you to do is to go ahead and put in the chat your name as well as your partner's name. We'll create a breakout room specifically for the two of you, and we can do it for as many folks who provide us that information as need be so that you guys have that time and space to complete that activity. Once you complete that activity, please email that to the MHN email address that will be thrown in the chat as well. If you were one of those folks that had a challenge in downloading the actual bingo tool and you asked Kim to email it to you directly, she's already done that. So she received about 10 requests. She sent those out. If you thought that you requested that but didn't receive it, please throw your email in the chat and we will make sure to get that tool to you. And with that, we are going to go ahead and break for lunch. We are going to be putting a timer on your screen so that you know when to come back, but we are going to be reconvening at 1 o'clock today. And if you need any technical assistance, of course, you can reach out to us in the meanwhile. With that, I'd like to thank you guys for spending your morning with us, and I look forward to spending the afternoon with you shortly.
Thank you, Lisa.
Thank you, Loya.
You're welcome.
All right, Miss Lisa, I think we go ahead and get started and be considerate of folks' time. So welcome back. We hope you had a great, nutritious lunch. I had a bunch of because I just came back from vacation and I came back a little heavier. So I needed some salad, but I hope everyone had a nice break. I know it's a lot to ask of you to be in front of your screen for this long. It looks like we lost our screen, but that's okay because we just have a couple of housekeeping items before we jump into just some super exciting stuff for the afternoon. Before I jump into what's on the screen, I'm actually gonna do a final plug. The email for your bingo is in the chat. So if you have not done so already, please email us your bingo card. If it is in my inbox or the Maternal Health Network's inbox by 1:05, I think that we can enter you into our raffle. Okay, second thing is, again, we will be using our Zoom breakouts, our polls, our survey, all the good things. And so that Zoom technical guide, I will throw in the chat after I hand it off to Miss Marika for the engagement activity, but that's full of all of these tips and tricks on how to set up your Zoom to make sure that it is effective and that you can participate to the fullest extent possible. One final plug, Sierra is your go-to for Zoom technical difficulties. So if you run into anything, you're also welcome to just put a call out to everyone in the Zoom chat saying, help me, and we will reach out to you one-on-one, or you can chat Sierra directly by finding her name in the to button in the Zoom chat, or you can text her. Don't call her because she's on the line with us here. But if you text her, she's so great at following back up with you and helping get any issues that you may have resolved. So with that, I'm going to hand it off to Ms. Marika to get us a little energized before the next series of activities we have.
Okay, so besides getting engaged, one of the things that I love to do is move. And so before we hop into this activity, I just want to say, I want to recognize that we all come to the table with different abilities and different bodies. So I just encourage you to do whatever is available to you today and whatever you need to do that suits your body, modify as you need. The goal is just to move a little bit, get re-energized, get ready for the fun stuff that we're going to do this afternoon, and just realize the benefits of exercise slightly. And so what we're going to do is an activity called Stretch and Share. I highly recommend that you take this to your meetings as well. We sometimes do it internally at SEI, and it's really great. I'm going to do a stretch. You do it. You can do it with your video on or off, however you feel. And then I'm going to pitch it to somebody else on my team. If you can stand up, go ahead and stand up. Do whatever works for you. So this one is just a neck stretch because usually when we're working, we get like pretty intense. I don't know about anybody else, but I'm like always up with my shoulders around my ears. So what I like to do is just relax your shoulders a little bit. Turn your head to one side and drop your chin. And you should feel a nice stretch in those scalenes, those muscles there around the side. If you need a little extra, you can take the opposite hand from where your chin is pointing. So I'm looking to the left and I take my right hand and you can just push it behind you and below. So down below your shoulder, just push it down and you'll feel like that extra little stretch on that side. And the deeper you look down sort of at your shoulder, the better it's going to feel. And then go ahead and switch sides. Turn to the other side and look down, and then you can engage that opposite arm and shoulder in creating some sort of counter tension there, and it should feel really nice. And then I'm going to pitch it to somebody else on our team. So Miss Lisa, how do you feel about leading the stretch? Oh, you're muted.
Thank you, Ms. Marika. I'm feeling great. So I'm a yoga fan, so I'm going to ask you guys, if you're yoga fans, to do a ragdoll stretch, but it's a really great stretch for the spine. So what you do is I'm going to just demonstrate it, yes, to the side, and you're going to roll your body down and then act like a ragdoll. Your arms may reach the ground, it may not, but then I also want you to release your neck and just sit there like a ragdoll for a few seconds. And then slowly roll back up. Up, yes. Didn't that feel good, folks? Love it. All right, Miss Katie, do you want to lead us through a stretch?
Sure, I'm happy to. Well, my wrists and arms always get a little crunched up, out of sync after being on the computer all day. So mine's simple but effective. So just pull down your fingertips out, stretch out your arm all the way, and then pull down on your fingertips with your opposite hand. Giving myself a little bit extra time because realizing I need it. All right. Ooh, that felt good. Miss Kelly, do you have a stretch you want to share?
Okay, so mine's a little wild, but it's to get the synovial fluids going. So we're going to put our hands up like this, and then we're going to reach them up higher, and we're going to just shake them. So you're just shaking them back and forth, hands too. You can move up and down. There you go. And I will pass it to Kim.
All right, so I think another one for kind of stretching out the back, go ahead and put your arms right in front of you. I think everyone remembers this. This always makes me think of like middle school gym, but go like that. And if you want, you can kind of arch your back a little bit if you want to like lean into it. Sometimes that feels good. And then same, if you do that, when you come back up, roll up like you did when you were doing the rag doll. Just kind of push out and kind of do your shoulders a little. All right. And then are we passing it to one more? Are we going to pass it to Megan?
I think Emma still needs to go too, doesn't she?
Oh, Emma, you want to go next, Emma?
Sure. So let's just do some shoulder rolls. And as you do that, just try to take a deep breath in and a deep breath out. So some shoulder rolls, we're really focusing on some nice deep breaths. And then the other way. All right. Are we doing any more? Or do you think that was a good amount of stretching?
I think that was really great, you guys. I really appreciate it, especially after 3 hours of a Zoom meeting, a little bit of a lunch break. I hope folks are excited as I am. Thank you, SEI team, for leading us through that exercise. Okay, so super excited. I'm going to sit down. Super excited because now we get to share with you guys what work we've been doing around developing a criminal justice protocol. And as Karen mentioned in her opening address, this is a really targeted population, high risk, high vulnerabilities, high, social determinants of health. And so they're one of our priority populations, and we've really emphasized our efforts in working on developing a criminal justice protocol for our target population. So go ahead and advance the slide, Megan. So I thought it would be helpful to just remind folks, like, why are we here? Why did we say there was a need for this particular intervention? So I just want to remind you of some things that we found throughout our needs assessment process. The first thing we identified was that there really wasn't coordination to care upon release. So this particular population does provide or does receive some supports when they're institutionalized, but after they're released, the institution doesn't actually have any contact with those individuals. And so that continuity of care really was missing and something that was identified as a need for this particular target population. The second thing that we identified was that the system often doesn't have an advocate or have an advocacy space for women who are incarcerated and who are pregnant. And that oftentimes the services that are provided are inconsistent, sometimes unreliable, and that's really just based on whatever competing priorities are going on within the institution. And then the third thing that we saw is that, of course, this is a target population who really is at an increased risk for suffering from multiple social determinants of health. And for that reason, we really wanted to see how could we, at a systems level, help improve outcomes for these folks. So we identified the need to establish a criminal justice protocol, and one that would really serve women when they were institutionalized, but provide continuity of care upon their release and while they're in the community, really wrapping around a system of supports as well as services that would help them succeed in kind of 3 different areas. And this is something that we identified through the course of our conversations with our criminal justice core team, which we're going to get to in just a moment. But we said we really want to support folks kind of in their needs around pregnancy, right? That's our primary issue for the Maternal Health Network. But we also wanted to support them in creating an environment where they were less at risk for recidivism. And then the third thing is we wanted to address some of those social determinants of health that we know put them at an increased risk for poor maternal health outcomes. So this whole process is really meant to establish a protocol that would hit those three areas, of course, placing the priority on their maternity status. So this one is a very long action plan, right? We've got 8. You saw in some of our other areas, we had anywhere from 3 to 5. This one, because it's complex and requires multiple partners and multiple levels of engagement, really has 8 steps to get us to where we actually want to be. So I'm going to go through kind of the efforts that we've taken to date, and then I'm going to transition. We have a couple members of our criminal justice core team with us to share their experience, and Ms. Kelly is actually going to facilitate that panel discussion with us. All right, so the first thing that we had tasked to do was to establish this criminal justice core team, right? There's a number of folks who we needed to engage to establish this protocol. We've engaged the San Bernardino County Sheriff's Office. We've engaged the inmate services, specifically the Faiths Through program. And we have a representative from each of those organizations with us today to join us on our panel. But we've also engaged the Public Health Reentry Collaborative, which is actually made up of a number. I think that they have over 30 organizations who participate in the Reentry Collaborative that serves folks who are re-engaging in the community after incarceration. And then the last but critical partner is Inland SoCal United Way. They are the ones who operate the 211 system, and they have their tentacles in a variety of different places. They provide homeless services, they provide reentry supports, and they are the host of the 211, which makes them a key partner in getting folks connected to care. So that was the first thing that we did. The second thing that we had tasked to do was to research and identify assessment tool options. So remember I had mentioned we were looking at those 3 kind of areas, right? And so we wanted to see what assessment tools already exist that may be able to serve our needs. And the assessment tool that we were looking for was really something that would identify what are the needs of these women, both when they're incarcerated, but also when they exit back into the community, and how could we customize it to support their needs around their maternity health. And so we identified 9 different tools. We developed a criteria, and then we met with our partners to say, okay, here are the tools that we've identified. Here are the strengths and the weaknesses. Here are the pros and cons. And which one of these tools should we use for our purposes? It was excellent. In engaging the inmate services Faiths program, they said, you know what, Lisa, we're already going to be launching this best practice tool. They sent it to us. It hit 2 of the 3 marks that we were looking for. So it really did address their re-entry needs as well as social determinants of health. What it didn't have was that maternal health component to it. So we mutually identified between our 4 partner agencies, well, we could come up with a supplemental that we could add to this best practice model. And that's what we identified would make most sense for San Bernardino County. And so we have now drafted a criminal justice brief that actually documents our process up to that place. So this has yet to be finalized, but once it is, as with all of our resources that we produce on behalf of the Maternal Health Network, it will be posted on our website and available for review. Okay. So the third task was really meeting with community partners to identify the process for assessment and referral. And so we have had probably a half dozen meetings thus far. And the intention of those meetings is to identify the supplemental assessment, that's kind of next on tap, to develop a flow chart of interventions, because each one of those entities will intersect and provide some level of support to our target population. It's important for them to understand, okay, what part in this process do we play a role, and where should we, refer folks to and next steps and understand next steps. And so we're in the process of doing that with our 4 partner agencies right now. We'll also be establishing what are the roles and responsibilities of all of these community partners from the time of incarceration through 3 months post-release. So those are our efforts to date. You see, we've accomplished 3 of our 5 sort of major milestones. We will wrap it up over the next 12 months, but right now I'm gonna shift and introduce our 2 panelists. So we have Evan Thomas, who's with the Faith Through Care program. And Sierra, if you wouldn't mind highlighting these folks for us, that would be awesome. And then we have Cece Spurlock, who's with the San Bernardino County Sheriff's Department. And Cece, you have a partner with you. I think that it is your maternal health, the maternal health individual. But I will let you actually introduce your partner because I think you guys are tag teaming this, yes?
Yes, yes, we are. Hello, everyone. I'm Cece Spurlock, and this is Emily Newton. Hi. She is with our education and training team with the Health Services Division.
Perfect. Well, thank you, Cece. Thank you, Emily. Thank you, Evan, for joining our panel discussion. So I'm going to turn it over to you, Ms. Kelly, to facilitate this.
All right. Well, thanks to both Evan and Cece and Emily for being available today. We're going to start with Evan. So Evan, how do you anticipate that your participation in the MHN Criminal Justice Court team benefits your organization? How does it help you advance your organization's mission?
Sure. So again, I am from the Faith Through Care program. FAITH standing for Family Attachment Intervention Through Healing Solutions. And this is a reentry program for the justice-involved population. I would say one of the key benefits that I would foresee working with Mental Health Network would be to educate us on best practices to serve the incarcerated pregnant female population and get us connected with potential partners that provide services to this population. We generally provide services utilizing the Ohio risk assessment system, and based off of low, moderate, high, or very high risk needs is how we've been determining who we work with. But working with MHN has just been able to kind of focus our sites and services on how to serve this population. And actually, Mental Health Network has already inspired us to look at solutions for other special populations, such as the justice-involved individuals living with autism. So I anticipate working with Mental Health Network will also keep faith programming culturally competent regarding this population and just solidifying the likelihood that faith clients feel our services adequately meet their needs.
That's great. Thank you, Evan. Okay, so Cece, same question for you, and you can pitch it if you would like to Emily. So how do you anticipate that participation in the Maternal Health Network Criminal Justice Court team has benefited your organization or helped you get closer to your stated mission?
Well, our participation in the MHN has benefit our Sheriff's Department because in our specialty, being a corrections facility, the amount of time we care for these patients varies. For example, it could range from hours to months, depending on each individual's circumstance. Once the patient is released from our custody, we have very little influence or impact on their care, as Lisa had mentioned earlier. In addition to our department's existing pregnancy protocol, we have developed guidelines that will ensure any identified pregnant patient is connected to the available resources prior to release.
That's great. Thank you so much. Okay, so now I think we'll stay with you, Cece, for the next question. Right, so how has the support of MHN in coordinating these efforts, and we want to kind of drill into that coordination piece, and completing activities in between meetings helped to advance the work? Specifically, what should people know that you know about how MHN can help move the work forward?
Well, I'd like to share that utilizing MHN has helped to facilitate collaboration between Correctional Health Services Division and Inmate Services Unit within the Sheriff's Department. Once we gained an understanding of what resources are available to our pregnant patients, We are motivated to educate and encourage our patients to utilize the pathways, such as utilizing the kiosks that are easily accessible at any time while they're incarcerated within each of our jail facilities. Our goal is to promote better outcomes upon re-entry into the community, no matter what phase they are at within their pregnancies.
All right, thank you. So I think we'll go to Evan next. Same question, Evan, what would you say?
I would really just say that Maternal Health Network has notably lightened the load with coordination efforts for meetings. FACE is going to involve a plethora of entities within the criminal justice system, anywhere from the Transitional Assistance Department to the DA's office. And typically our meetings so far have been to 1 to 2 partners at a time, which is manageable. But as meeting participants increase, it becomes increasingly difficult to coordinate openings for Zoom meetings. I'm sure all of us here have experienced trying to get multiple populations and groups together and had to go through the woes of that. And Maternal Health Network has just really streamlined the process. And especially focusing, like I was saying before, getting us connected with partners that want to work with this population. It has been more of a generalized connection that we've done so far, but this has really streamlined the process and just got us connected ahead of time, such as working with CC already. CC's provided me recently a process map for what the incarcerated pregnant females go through while they're taken in West Valley or any other facilities. Also giving us we've been working together to figure out some solutions for kiosks, because we want to make sure as the nurses that work with incarcerated pregnant females encourage them to get connected with FACE, that they have an easy, user-friendly way to get connected to us. Right now, our kiosks, it's a little unclear how they would get connected with FACE staffs, but working with Maternal Health Network and CC, we've identified ways to get over that.
Great. So before we get to our third question, which I think is going to be the hard question, because that's where we're going to start to get real. I just want to encourage everyone. I saw that Katie put a note that you can pose questions in the chat. So if you have questions for either Evan or Cece, go ahead. We will have time to field your questions at the end of this session. So go ahead and put those in the chat. Okay, so now getting to the reality of collaboration and a collective impact approach. What would you like other MHN members to consider regarding that collaborative approach? Tell us about the reality of taking a collaborative approach, what the benefits are, but then also what the realities are. So Evan, you go first.
I would say it's good that you asked about the realities, because it's clearly not as easy as it may look on paper. Collaboration is really an integral component of what the Through Care process employed by the FACE Through Care program. It's what it is. It's a collaborative and coordinated effort between all involved entities and sharing data and really just aligning procedural modalities. And that is where the hitch really comes in, because oftentimes really working with any treatment process or any population, a lot of the entities working together work in silos. One might say, I'm doing this over here, or I'm doing this over there, but we don't often bring our resources together just because it's difficult. Everyone has their own schedules. Everyone has their own way of doing things. So it's really about establishing that baseline, which Maternal Health Network has already done for us. And then we just keep on growing from there. Really, like I said, Through Care is the key component about FACE as a reentry program, that we may have some student interns from the FACE program working with CC, working with probation, working with safety staff, or whoever they have to work with. And we'd all come together and share our findings rather than being like, this is my data, I'm just going to keep this. And if you can get past the early kinks of collaboration, I really think there's no better way to do it, because we're all trying to serve the same population at different points in their treatment process. If the left hand knows what the right hand is doing, things just work better.
Thank you, Evan. And we may come back if we don't get any other questions, and I'll ask you to kind of lay out some of what the early kinks, specifically were. But Cece, you're in a really different system. I mean, you're working in, a structured county system that is part of a bureaucracy. And so that often makes collaboration difficult. So from your perspective, what do you think people should know about that collaborative approach?
Well, with working with MHN, this entire process itself, I know that we go way back to 2019, has truly helped us to identify our needs within this classification of patients. MHN has supported us as we continue to build a stronger partnership between Health Services Division and Inmate Services Unit, working with Evan within the Sheriff's Department, with Evan and his group. But with MHN's ability to coordinate meetings, and communication between a variety of sectors, it has really helped to streamline the process, which has allowed us to appropriately meet the needs of our pregnant patients. And I know that moving forward will continue to help us better meet their needs. I mean, based on what we've identified within the last few months, and to be able to create a flow process. And our conversations with Evan has been wonderful. We've been able to, everything is in draft right now, currently work in progress as far as our initial B assessments when we meet with pregnant patients. That would be in addition to our pregnancy protocol.
So Cece, just to follow up on that, because of the system that you work in, we have many other county agencies that participate in MHN, as well as, nonprofits, larger organizations and systems such as, healthcare systems. People often in a governmental entity or governmental role can say, you know what, collaboration is just really hard because of the systems and the hoops we have to jump through. So can you speak to that and kind of what the value proposition is, like what some of the challenges may have been for you initially and how you've overcome them?
Oh, well, I'd say challenges, of course, with government agencies. And like Evan had mentioned earlier, a lot of times we, even as a government agency, we tend to work in silos. And like the Sheriff's Department, we have different areas. We have the custody side, and through MHN, we found out about Inmate Services Unit. And without MHN, we would not have known what services and resources, the amount of resources that we found out just discussing it with Evan and Lieutenant Porter. We were amazed. So just making that connection, and again, that I would say with a government agency is not knowing who is doing what until these type of meetings happen, and we work collaboratively and be able to share what resources, what services, what we're working on, what type of protocols we already have in place that we can achieve together, to make things better. So
thank you. So I think we do have a question in the chat. Katie, do we know who the question is for, or should we pose it to both of our panelists?
It's for both Evan and Cece, and I am so excited to hear the responses from you. So the question was sent directly to me. What would you say is the ideal reality you are trying to create for this population? Evan, why don't we start with you?
Ideal reality to create for this population? Really just that they feel supported throughout their whole time, throughout the criminal justice system, and that, we've typically had a very punitive approach to criminal justice, but really the point is rehabilitation. Something happened on the outside and then that crime has to be paid for, but then the point of the rehabilitation is to get education, resources, and support so that that healthier lifestyle can continue once you're out of incarceration, and in turn reduce recidivism rates because you get out and stay out. So essentially, we don't want anybody to feel that interacts with the Faith Through Care program that I don't know what to do next. I don't know who to call. We want them to know it's like, okay, this will be difficult. This will be challenging, but I don't feel like I'm left in the dark. Typically what's happened with rehabilitation before is whatever in custody education or support you get, everything's great for a while and then you get released and it's good luck. But now with Through Care, with us being able to extend that rehabilitative services to the outside as well with the clients that we build rapport with, now instead of good luck, it's instead, come on, or I'll go with you. And rather you could just have that supportive holding hand. So the reality that I would like is that really whoever engages with the Phase Through Care program and with the help of Maternal Health Network feels, as tough as the journey might be, that they're not alone.
Wonderful. Cece, what would you add?
Wow, what can I add? Wow, Evan, very impressive. And I couldn't agree more than what Evan just provided, because it is really important. One, that we make the connection. The minute that the female pregnant patients walk in, are screened, identified by our medical RN staff at the time of screening when they're being booked. Really important that we make once we identify them as being pregnant, as we have been, we make the connection with them to be seen, followed up with EMC OB. And then when they come back, when they return to our facility, that as we complete our screening, if they're identified as having any mental health needs, we connect them right away with our mental health team so that they receive the appropriate medical services. And as moving on while they're incarcerated, that they also make a connection with our nurses while they are receiving the appropriate medical attention and care, which is very important during their time of pregnancy, and not only while they're pregnant, but even prenatal, but postpartum, that we're there, and also connecting them with the appropriate resources, which we just recently found out that inmate services that provides. Gosh, I don't know how I could add any more than what Evan provided, but yes, it's really important that we connect the identified pregnant patients with the appropriate needs while they're incarcerated and then upon release into the community.
Thank you, Cece. We did have another question that was direct message to me. So I think it's for you. So for those women that have delivered, what is the status of setting up a breast milk collection program for those delivered patients?
Great question. At this time, it's interesting that this is being asked because at this time, we are currently working on that to accommodate, although we do provide them the breast pumps as needed, but the collection of breast milk, which is really important for their infants. We understand how important it is, the collection of that, and to be able to provide that to the family members. We are currently working on our protocols on that so that we can accommodate the patients and their babies.
So, and what we know is because of the communication that you both highlighted as part of the collaboration, that as that protocol gets developed, we trust, Cece, that you will share that as part of the CJ core team, and we can let the rest of the group know. So we'll keep you posted, everyone, about the evolution of that project. Okay, so Lisa, I think you wanted to jump in before we kind of wrap up the section.
It did, and it's just because as much as I would love to have the MHN take credit for bringing faiths to the table, it wasn't us, but it was a byproduct of the collaborative. And so it was actually Gary and Angelina at United Way who said, I really think you guys should get connected with these guys over there at Fates. And so it was just another manifestation of bringing the people to the table who knew the other people who needed to be at the table. You know, as the backbone support to the MHN, we are not subject matter experts, and we don't have all of the information needed to make these things a reality. But what we do have is relationships, right? And a passport. And so having those relationships and creating a space for that to occur is really what manifested in bringing Faith to the table, and then now being a core component of this protocol. And so I just wanted to give them a shout out. And then I also wanted, neither United Way or the Reentry Collaborative could join us today, but Carolyn over at Public Health with the Reentry Collaborative, she said, would you guys mind coming and actually presenting to the Reentry Collaborative the work that this group is doing? And so we're on tap to do that in the next month. And we're hoping that we can, continue to expand the partnership to make this a reality for this target population. So I just wanted to add that. Thank you, Kelly.
Thanks, Lisa. And actually, along the lines of expanding the partnership, there is one last question. So I'm not going to pose it. I'll read it. And then Evan and Cece, it was posed to both of you. It's in the chat. So if you want to respond individually by responding in the chat to everyone, then they would see that question. And it's basically, what nonprofit organizations have you partnered with for after support? Okay, so I want to thank both Evan and Cece for really bringing the Maternal Health Network vision to a reality and expressing it in the work that you're doing. I mean, you really just modeled everything that we hoped for when we embarked on this journey. So next, we're going to transition to Lisa, and she's going to talk about Maternal Health Network efforts for the next 12 months. That does include the criminal justice piece. And so you'll see that embedded in there in terms of adopting the protocol, advocating for the protocol with community partners, and then seeking funding to support implementation. So Lisa.
Thank you, Ms. Kelly. So yeah, I actually, I think I'm best suited to answer Myra's question, and it's in an upcoming slide. So I would just ask you, be patient, Myra. I'm going to answer that question here shortly. Okay. So this is a reminder, and this is a setup for our afternoon breakout sessions, right? A reminder of what are our short-term priorities. So as I had mentioned at the very front end of our time together today, we have 14 strategies in our strategic plan. Of those 14, 6 of them were deemed short-term, which means that we would take action on them within the first 2 years. That includes support for the Perinatal Equity Initiative. You've heard about that. The Criminal Justice Protocol, which you just heard of. Our community education campaign and distribution of educational information. Our workforce development efforts, and then our proactive screening and education. Now, the consumer survey data collection actually falls within a midterm priority, but we saw an opportunity and we seized it, and therefore we've made some progress on that earlier than anticipated, which is always a good thing. So go ahead and advance to the next slide, Miss Megan, and I'm going to share with you just kind of a high level, I love that word, high level overview of what we're going to be doing over the next 12 months to kind of round out our short-term strategies. And then hopefully this helps you determine which one of these areas do you want to offer some additional input into. And we will be breaking out into 5 different breakouts to kind of do a deeper dive into what the next 12 months looks like and how you guys can provide us with some additional information to support our efforts. So I'm not going to go in the order as seen on the screen because I want to address the criminal justice protocol, given that we just heard from 2 of our colleagues and the question that Myra posed. So what we need to do over the next 12 months to kind of finalize our criminal justice protocol is we need to complete the protocol, right? I talked a little bit about what that's going to look like. We need to, finalize the supplemental question that's going to be added to the ORIS. We need to do that that flow chart, define roles and responsibilities, and that really will define kind of what does the protocol look like, both for services while they're institutionalized, but also when they re-enter into the community. So the second bullet, I think, addresses your question, Myra, which is advocate for the protocol with community partners. So part of us going to that reentry collaborative is to introduce this concept of this change in practice by these partner agencies that make up the CG core team. And what we want to do is we want to start to develop a relationship with those folks to say, this is coming, and when it comes, we want you to be aware that you may start receiving referrals, you may start receiving contacts from these folks to help support our target population. So we expect that the folks who are part of that reentry collaborative will be integral in both supporting and receiving women who need their supportive services. So what nonprofits, I can't tell you yet. We're working on that, but we imagine at a minimum, they will be folks who are engaged in the reentry collaborative. Myra, if you're an organization who you feel like we need to connect with you, please feel free to reach out to us and we will make sure to include you in our communications when we hit that stage of our process. So I hope that answered your question. And then the third and final component is we really want to see this support fully funded. So one of the things that you guys told us when we were developing the action plan around the criminal justice protocol was ideally we would connect folks with a case management approach while they're in the institution that would follow them outside of the institution, right? So they would be developing relationships with this priority population who, sometimes have trust issues. We don't want to be expecting that they are going to go and have to develop relationships with multiple service industries and have to navigate that themselves. We really see a relationship being developed as a core element of success in supporting this priority population. And so we want to give the funding that's necessary to support that full-scale case management while they're institution and transitioned out back into the community. And that's going to take some additional resources. So we see that as a role that the MHN can play, is that we can actually seek out and then apply for supplemental funding that our community partners would benefit from. So that's the criminal justice protocol. That's what the next sort of 12 months looks like for this. You'll see that when we go on to the breakout sessions that there's not a CJ team, and that's intentional because we really need to work with the core partners who are part of that CJ core team, and we will only be engaging with the membership when we get to that second stage of where we have a protocol, and now we are relying upon you to kind of lean in and provide some of those supportive services. So with that, I want to give a high-level overview of the remaining 5 areas where we actually do have breakouts established for the afternoon session. So the first one is PEI. So the 3 things that we're going to be doing over the next year, we're going to continue to promote the messaging that I shared with you earlier through our website, as well as through our social media and our newsletter. So you'll continue to see our support and our gentle nudge around messaging that supports the PEI. We'll continue to support service connection. So I'm so excited for those of you who are going to be joining me in my afternoon breakout, because we're going to show you how we have actually added to the MHN website a process where you can actually refer folks to BIH as well as the PEI programming directly through the maternal health website. And then the third thing that we're doing is we are actually serving as a collaborative partner to the PEI Community Advisory Board, and we're sitting at the table as they develop a summit that's going to occur in 2022. One of the things that makes the Maternal Health Network a good partner is that we participate in multiple community advisory boards. So we participate with the Inland Empire Breastfeeding Coalition, we participate in the Maternal Mental Health Coalition. We do a lot of things that that cross sectors. And so coming to the table, we represent not only the Maternal Health Network as an entity, but all of those sub-networks that have mission alignment. And so that's how we're supporting the PEI over the next 12 months. All right, community education. And I think that Katie will actually be facilitating this breakout session. And community education, it really serves two purposes, right? We want to change people's knowledge. That's where we come up with those large kind of community messaging campaigns. But then we also want them to use that knowledge to change their behavior. So I've combined kind of those two very distinct strategies, but connected strategies into one breakout session for the afternoon. Things that we're going to do over the next 12 months, we need to develop and implement our large-scale messaging campaign. We need to complete all of our educational bundles, and then of course we will continue to promote messaging on our website as well as through all of our social media. And we provide multiple postings over the course of the week on a weekly basis. Okay. So around service expansion, it's really around those proactive screening and education efforts. So we have to complete our best practices brief, right? And that's, you'll find out a little bit more about that. Kelly is actually facilitating that breakout session. We need to establish the protocol similar to how we've structured the CJ system. This one is going to be a little bit more broad because it's not specific to a target population, but rather proactive screening around mental health, behavioral health issues, as well as healthy habits. And then we need to advocate for that protocol with our community partners. And then the last thing that we heard would be helpful in implementing a proactive screening and education approach is providing motivational interviewing training. So folks said, yeah, that is central to actually conducting proactive screenings. And so that's a support mechanism that the MHN can offer to multiple sectors who may be providing those screenings. Okay, the next breakout and the next kind of area will be around data collection. So Kim is going to be facilitating that breakout session. And we're going to be talking about, okay, should we look at refining that data collection tool, right? The survey that we collected, as I'm sure you guys saw by the depth of the data that we presented, it's only a slice, right? We have created a very comprehensive survey tool, but in doing so, we heard it takes folks a little bit of time. We may want to refine that. So we would explore with you in that PM breakout session, well, what would that look like if we did continue data collection efforts? What kind of refinement to that data collection tool is necessary to optimize it? And then we would want to continue to work with community partners to explore ongoing data collection. So one of the things that the pandemic did is it made data collection very, very difficult, right? We were planning on distributing it through multiple sites, and then, you know, people within the healthcare industry, some folks said, it's just not our priority right now. We think that this is important, but right now, all hands are on deck for addressing the pandemic. And so we would want to continue to explore the opportunity to distribute that survey through multiple networks. And like I said, the PM session, if you choose to go into that breakout section, we'll explore that a little bit. And then we also want to think about, well, how could we make this data available in real time? Remember I had mentioned when I talked about the data being one of our 5 strategic goal areas, that sometimes data isn't utilized because there's such a delay in between the time that it's actually collected and produced. So we're thinking about, is there a way that we could actually provide real-time data to our membership? And if we were able to do that, would it be valuable? Like, is that where we should invest our time and energy? So that's our data collection efforts. And then the last area that we're going to have a breakout session on is workforce development. So we really want to take a look at how can we promote partner training opportunities? Should we continue to do that? As I had mentioned in our AM session, we haven't had a whole lot of inputs around that area. So if you want to participate in our PM session, we're going to ask you, like, what tweaks do we need to make to our process? Or should we be doing something other than this? Is this not the most valuable way to actually impact this particular area? The second thing that we're going to do, and she'll talk about, Marika is actually the one who's going to be facilitating this breakout session, is we will be providing annual training. So one of the things that you guys said, it would be great if we knew that at least on an annual basis, we could go to the MHN network and make sure that our staff receive these 3 core trainings: implicit bias, social determinants of health, and its impact on maternal health, and of course, cultural competency. So we will be training, providing an annual training on those 3 topics. And then the last thing that you guys said would be useful is establishing a train the trainer resource. And so that's really about, you know, equipping our MHN membership as sort of master trainers that the whole membership could take advantage of. It's really taking that compendium that we developed of external resources, which oftentimes will require finances, and really kind of shifting and saying, well, now we've built our own internal county-based resources, and we can rely upon our partnerships to get our needs met in a different kind of way than we're used to. So that's kind of a high level overview of what we're doing. And like I said, we're going to be taking this into our breakout sessions and digging a little bit deeper. So you guys will be able to self-select into each breakout session that you want to attend. So let's go ahead and go to the next slide. Okay. So really quickly, we are going to launch a poll, and we just want to kind of get a reading of the room, right? We don't see the whites of your eyes oftentimes when we do this in a virtual setting. So let us know, like, of these short-term strategies, what are you most excited about? I'm going to give you guys about a minute, and we're going to hopefully reach that 80% threshold before we share the results. You guys are doing great. We're at 70%. We'll give it a couple more seconds. Hopefully we can reach that 80% threshold, and then we will take a break. Well, so interesting. Okay, I'm going to go ahead and close the poll. And again, I'm getting an error message. So I don't know if you guys can see the results, but I'm going to share them with you verbally in the event that you can't see them. So what are folks most excited about? There's kind of a split between our community education efforts and our criminal justice protocol. I can't help but wonder if that's because we shared with you some of our partners. And so I too I'm excited about all of it, but that's where folks seem to be most excited is around our work with our target population, women who are pregnant and incarcerated, and then of course our community education efforts. So that's great. Thank you guys for sharing. All right. So with that, you know, I am not good at breaks. And my team always tells me, Lisa, you have to build in breaks. And so they are now forcing my hand by including a slide in our PowerPoint presentation. So you guys have about 8 minutes to take a break. And then we're going to finish strong in our last hour of the day when we return at 2 o'clock to go into our breakout rooms. So with that, I will see you guys shortly. We've got about 7 minutes now. Hey guys, I think we're having some technical difficulties because we were not supposed to be redirected. We were supposed to have 40 minutes together. Sierra, can you hear me?
Yes, I can. That was probably me. I thought it was 20. Would you like me to reopen them?
Yeah, because you can't put folks back into the same rooms that they were in. They have to self-select back into those rooms.
I
So
believe.
Lisa, I think this is a great opportunity. We actually, in our breakout, got through all the questions, but we would love to test those questions with other folks. Are there other SEI facilitators that also got through all your questions? Yeah, so I think we all were planning on the 20 minutes piece, but we did get feedback, Lisa, that folks were really interested in multiple. So this could be an opportunity to do a lightning round and let people select a different breakout group.
Yeah, so I think that we go ahead and open up the breakout rooms. The PEI group got about halfway, so we didn't get through ours. So if you want to join the PEI, that's just fine. You can join midway, and we haven't actually gotten to the discussion part yet. But if you were in a group and they wrapped it up, you can go ahead and self-select, and we'll just repeat it for those who got through all of it, and then folks can participate in more than one breakout. So Sierra, would you mind opening those rooms back up, and we will meet until 2:40, and at that point we will come back into the general session.
Yeah, I'll do that. And it may automatically put you back into the room you were in. I'm not 100% sure, but I'm gonna open them up and we'll see.
Okay, thank you, Sierra. Thank you guys for having patience with us as we work through the technical issues.
Yeah, so if it puts.
It will. Cool. Thank goodness.
You're muted, Lisa.
Thank you, Marika. I see folks are making their way back into our general session. Give folks a couple of seconds to return. I hope you guys had fruitful discussions. We actually just made it through our presentation and our questions in the PEI work group. All right, so I'm gonna actually ask Ms. Sierra to spotlight the facilitators of the breakout sessions, and each one of us is just gonna give a brief summary. So if you weren't able to participate in multiple breakouts, but you're interested in knowing what came out of that, that's what this is meant to do, is just to highlight some of the key findings or data that we collected from you guys in our breakouts. And so I'm going to ask, is there any volunteers to go first?
Go first, Lisa. And the reason why is because I only had one. I didn't get to like the Redux version. Everybody was too interested in the other topics, which is great. Because my topic was workforce supports and trainings. And what we really asked was kind of a two-part set of questions. We asked, in our current context, as America is experiencing this reckoning with racism, are the types of trainings that we had already identified, are these still the right trainings? Or is there something more? Do we need to go deeper into one of them? That kind of thing. And we, as you had already laid out, we had talked about social determinants of health, implicit bias, and cultural competency trainings as sort of being those three pillars. And the answer from my group, which was small but mighty, was yes, these are still the right topics. They make just as much sense now as they did then. And also that spreading out or like adding additional topics might diffuse the focus too much. And I thought that was like such good insight. And I think that they also noted that after we have these initial trainings, we might gather more data from folks about how to delve deeper or what topics to explore further. One person did note that if we were going to add one, having a workshop around like practical ways to ensure health equity would be really interesting. And I loved that idea, right? Like in a clinical setting, how do you really ensure health equity? And not just from the perspective of like a healthcare provider, but everybody on staff. And so I just thought that's brilliant. So I love this opportunity to connect with people. I think the other thing that we had asked folks about was whether or not the way that we were gathering information on the training topics that or the training opportunities that we provide on the website, whether that was working for folks. And they said, yes, yeah, we offer these trainings and that we could think of some other ways to solicit them. Solicit information about them. And so they said, you know, it might be a matter of us proactively going out and searching amongst the member organizations, like looking at their websites and seeing those. And I said, well, I just worry that we might miss an opportunity, right? Like we might see one there and not be able to get in. And they said, you know what, we need to make a periodic separate request. So not have it be in the newsletters, but be a separate request, right? Just for this information and be really clear about what the ask is. Are we asking about a training that they're offering, or are we asking if they know of other trainings, right? And just have that be a standalone request. And I thought, that's a really great idea, right? So kind of splitting the diff there. We're not going out looking for it. They're not necessarily having to go to our website to find it. So that was sort of the gist of what we talked about in terms of workforce supports and trainings.
Well, thank you, Marika. Indeed, small but mighty, because it sounds like you got some really good information that came out of your group. So thank you. And Miss Emma, I saw you unmute. Yeah, let's go.
I'll go next. I'm excited. We also had a smaller group. Kelly and I called it our key informant interviews because we had one person in each of the breakout sessions. So again, we were talking about the proactive screening and we were specifically focusing on healthy habits. That's what we were trying to learn a lot more about. So we first were trying to get a sense of who in San Bernardino County is doing these assessments. And it was suggested that WIC might be doing it, as well as Black Infant Health. And then there's also assessments that happen at the health centers. So we dug into a little bit about what those were. It covers everything from healthy eating and nutrition to PHQ-9 for depression and anxiety. And then we also tried to get an understanding of whether or not this was universal. And at the health centers, it was determined that major things like blood pressure and anxiety covers everyone. We tried to get a sense of whether or not our folks thought that these screenings should be universal or only targeted towards pregnant people. And both of our key informants said, absolutely, we should do this universally. You know, these impact everybody, and it's just a major issue. And then when let me see, sorry, my notes are a little messy. So we are trying to get a sense of who we should reach out to in order to reach non-pregnant people of childbearing age. And it was noted that that is difficult because a lot of women don't go to the doctor before they're pregnant unless they have an underlying health condition. So there's a suggestion to work with Medi-Cal offices, and they could possibly create a flyer or send a text to folks, just kind of detailing the importance of healthy habits. And then there's another suggestion that when people miss appointments, it's really important to call them and just do that direct outreach to try to get people engaged. We talked a little bit about motivational interviewing as well. And if there were any ideas for who could be a good trainer for that, the Department of Behavioral Health was suggested as a great place to start. And they could possibly point us to another outside agency we could work with. And then just some additional considerations to take in mind for the motivational interviewing is that clerical staff are often really good at this. And so they should probably be involved. They do a really good job doing the intake of the information and processing it. And then another point was that it's really tough for clinical staff to make, you know, a 2-day training to pull them off and then they're not seeing patients. So potential suggestion could be for having one person go and then take it back to them as sort of a train the trainer type process.
Wonderful. Well, thank you, Emma. It sounds like, yeah, small but mighty in your group too. By methods of deduction, I'm just wondering who got the bulk of the folks. So I'm interested in hearing from Katie and Kim. Who would like to go between the two of you?
So I can jump in because what I can say is that I did not get the lion's share of the attendees. So I think we're narrowing it down. So we had just a few folks in the first group, and then we ended up with one in the second who remained from the first. And that individual and I, again, had a great conversation, kind of a good key informant, like Emma and Kelly said. And I think what we really came down to is we talked through both sessions, but I think what it comes down to with the consumer survey report is that people need time to digest the report, to distribute it through their agencies, to seek feedback from folks, to really understand how is my organization going to use this. And so what we decided is what might be a good approach is that the MHN in a newsletter or an email blast should prompt for that kind of approach to say, hey, could you use this survey, like take this to a meeting, ask folks how they would use this, what would they do with the data, and which areas would they like to learn more about. And I think that could inform if and how we proceed with data collection efforts from consumers. So
wonderful. Well, thank you for that, Kim. I appreciate it. Okay, Miss Katie, it looks like you are the winner chicken dinner. What came out of your group?
Oh, it was just so good. And I want to be considerate of folks' time, but I had a large group and then it grew and it was so informative, but I want to raise 3 points. I have very specific detailed notes from it that we will certainly be using to inform our communications efforts. But I had 3 gems that came out of it. So the first was there was a recognition that the way in which people adapted to receiving information because of COVID is likely going to continue to be an effective way to reach people, right? Those things aren't going to be lost. So we should continue with those billboards and bus advertisements that we had originally envisioned, but we should also expand it to include electronic advertising. And so they said YouTube would be a great one where we can actually set a geographic limitation. So folks in San Bernardino County who log into YouTube to watch a video, they'll get an advertisement. And that's such a great way to get folks engaged. Second gem that I thought was brilliant was where do we want to put these billboards? Where do we want to kind of put these more tangible marketing materials? And someone said community hospitals, around community hospitals, because why? You'll catch families and providers. It is a great way to continue to raise awareness about these messages to providers and the families themselves. I also got very detailed notes on areas in which we need to focus, both for population density as well as underserved populations. So I thought that was great. The last is, and it's something that we can continue to discuss as we move along in the next year, was that there is a process that's pretty arduous for marketing materials to get approved in county institutions for distribution. And the MHN, in our collaborative fashion, I think people were inspired by the criminal justice protocol, said maybe this is some way where the MHN could serve as a hub in which we have the relationships, we have the connections, and we can actually offer that connection for folks to get their marketing materials approved through the county processes, but also ensure that our materials are co-brandable, just like with the community education bundles, and they're approved by the county processes, so that way folks don't have to undergo that. So those were the three things that came out.
Well, very good. Thank you, Katie. I'm interested in all the details. I can't wait to read them. So let me give you guys just a kind of one nugget that came out of our discussion at PEI, and then I'm going to wrap this up because we're getting close, right? So during our session, we actually walked through the 3 different programs that PEI is funding and how you can actually use the MHN website to refer families to those programs. And so the suggestion was made to actually record a tutorial about how you can actually do that and distribute that throughout the network and post it on the website. And so I thought that's excellent. That's an excellent idea, and we will definitely do that. The other things that came out were how we could actually help support connection to folks like WIC and 211, because they would be a referral mechanism that could likely really support connection to the BIH program as well as PEI. So without further ado, I just want to say thank you to all of my SEI facilitators and all of our program participants. You guys hung in there. You guys have made it to the end of the day. And so we are going to, I think we're going to skip the reflective exercise. I'm so sorry, Marika. It was a great one. We will carry this through to one of our future ones, but I want to be super respectful of folks' time. And we have a couple of things that we want to make sure we get to. One, of course, we're going to ask you to complete the afternoon evaluation with a Survey Monkey. Thank you, Katie, for putting it into the chat right now. Please make sure to copy that. You can throw it into your search engine and complete it. It takes only a few minutes. And then we also have some winners from our raffle from earlier today. So we had two activities that generated raffle opportunities. One of them was our bingo activity. And so we had 31 people participate, complete the bingo activity, and we have a pair of winners because you guys did this in a pair. So without further ado, our winner for the bingo was Elizabeth Sneed-Berry and Andia Malik. So you two will be getting a $25 gift card for completing the bingo. And then we also had a winner for the social media postings. And Kim, can you share with us who the winner is for that activity?
I don't believe we've determined the winner for the social media activity. So I think that one is TBD.
Okay, well, TBD, we will be reaching out. I know we had a few folks who actually completed the social media posting. We did get some feedback that said that was a little bit of a tricky exercise. And so I think one of the things that we will do, we're definitely going to put those folks who participated into our raffle. We'll generate a winner there. But I think we'll also do a tutorial on how to actually do those social media postings so that it's provides some sort of step-by-step instructions so that folks feel equipped to do that in the future. Oh, Sierra. Thank you, Sierra. We do have a winner for the social media posting, and it's Diana Marcella from El Sol. So Diana, congratulations on that, and thank you for posting those to your social media sites. And so with that, we have come to the end of our day. I just want to say it's such a pleasure to be able to do this work with so many committed and passionate people. I can't tell you, like in every single breakout that I participated in, you could tell people were excited. They're enthusiastic about the work that we have done and about the work that we will do in partnership. One of the major takeaways for me was how people were so excited about the promise that the protocol, the criminal justice protocol, is going to offer to our target population. And one of the things that I want to elevate for consideration for those who are still with us is we can do that in other arenas as well. I think that probably what got folks super excited about that is the fact that we were able to make significant progress because of the collaboration. And the MHN was just the glue that held it all together. We're excited, we're positioned to do that in other arenas. So we would just ask that you be considerate and thoughtful about how we could actually help you partner on other efforts that support our maternal health strategies. And we would be ready, willing, and able to do that in partnership with you. So with that, thank you guys for spending the bulk of your Tuesday with us. And as usual, you will receive our website, our newsletter on Friday, and continued efforts to support the Maternal Health Network. Thank you guys so much.
Thank you all. It was great. Bye.
Bye, Lori.
Thank you, everyone.
Thank you, everyone. Enjoyed it.
Good, good.